Hello, friends. All right, good morning to all of you out there, and a very, very warm welcome from the entire team of Private Tutors. Thank you so much for joining in. Is my voice audible and clear to all of you out there? Hello, hi Tura, hi Hayam. How are you guys doing? Thank you so much for joining in. Walaikum assalam, Sarah Liaquat. Thank you so much, girl. How are you, Amber? That's very nice. Thank you so much. All right, so great going, and I'm happy to have a start with the MRCPI OSCE. And I'm happy that you guys have been so enthusiastic in the group. Just give me a second. I'm gonna accept few of the participants. They're in the waiting room, and then we're gonna start it together. All right. Okay. Perfect. Okay. So how's everybody doing? Can I see lovely morning faces here? How are you guys doing? Warm welcome. All set to start MRCPI OSCE? Is it? What are the apprehensions? Hi, Tanya. How are you doing? Hello, Amber. So good to see you, my love. Long time. How's health? How's everything? Good. Oh, that's very nice. Others are still in the bed, is it? Ishwar, still in the bed. Hi, Deba. So happy to see with our daughters. Early morning, Deba. Hi, Kazi. How are you, my love?
Fine, Alhamdulillah, ma'am. How are you,
All ready
ma'am?
to start the preparation, yes? Hmm?
Yes, ma'am.
Enthusiastic,
Inshallah.
Rosina. That's great. Very well done. What are the anxieties? What are the stress? What are the apprehensions? I'm going to take your apprehensions first, and then I'm going to move forward to what I want to say today. I've got lots to give you in terms of information, in terms of booster, in terms of focus start. But before, I would like to know that what are the apprehensions which you guys do you have this feeling? Would we be able to do that? Is MRCPI OSCE doable? What are the feelings today? I want all the cameras, please. Let's have a chat. We are aiming November 2024. I'll give you so many examples of people who had done. Please, everyone, communicate to me so that we can take a perfect start today. Thank you very much. All right, so Diva, thank you, Farhana. So good to see you, my love. What are the apprehensions of OSCE?
Alhamdulillah, I have joined your group, so I don't have any apprehension. I have your results that all the all who have joined that mock and all have cleared. So I think if I'll do this course, then I'll definitely
I am
pass.
so
Inshallah.
grateful. Do you know that for you it might be a statement. For me, it's so much of a pressure. You know, when it comes to me, when I see people all over the world having so much faith and having so much of a confidence, yes, it gives sleepless nights. You know, it's thank you very much for this faith, and that makes me moving. Thank you very much. Amber, what are the apprehensions today so that we can address those apprehensions and do a perfect start?
Assalamualaikum, ma'am. How are you? It's just
Walaikum
the
assalam.
communication. It's just the
Okay.
communication, and it's two-way communication with good speaking skills and clinical skills. That's all I think. So not more than this. The
Okay.
time
So you're
management.
concerned. Okay. All right. So you're concerned about that the speaking thing has to be a strength, and you're concerned about the communication
Yeah.
has to be better. Yes? Okay, I understand. So
Yeah.
Yada Farhana, what are those things which we have in mind today? Those apprehensions to start with, lots of queries in the head which you want to get addressed.
Ma'am, we have to prepare ourselves and we need more practice.
Okay. So you know today that MRCP is about practice. You have done my job. Thank you very much. This mindset is amazing if you really know that this is about practice. Well done,
Yeah.
girl. Well done. Sabah
Mhm.
Fayaz Jilani. How are you doing today?
I'm fine, ma'am. How are you?
Oh, good to see you, my love. Alhamdulillah, all is good. Thank you so much. What are the fears of OSCE preparation? What are the points in your mind which you want to get addressed, or the things which you feel that where you would need more support?
Not exactly the fears, ma'am, but of course, the stress of presentation, the accurate presentation in a limited time period. Like I was doing recording of short cases, so
Yes.
it's really not easy to concise all the required information within the time period. In the long cases, we have good amount of time. Means if we
Okay.
are missing out anything, even at the end, we can cover it up by fixing some sentence, but the short cases really needs more practice, more crisp, and more accurate information. And of course, the stress to express it out, because even though we are well prepared at the time of presentation, we miss out, and this is very very natural. So
Abs-
I'm very hopeful that we are starting well in time. We have enough time to practice more, to ask more from all of you, and of course, from with all of your guidance of all the teams, especially you. Within 6 weeks, I cleared my written, Alhamdulillah, and most of the people with us also have done the same. So, inshallah, we are hoping for the best, of course.
why I'm doing this snowballing so that I exactly know different people have different background. Few have done MRCOG and they're coming here. Few are new, Kishver. You get it? So I want to know that where you guys stand so that I can take you forward because every student for OSCE is different. Few are good in communication, few are hesitant, few are confident, few have language barrier. I mean, different type. We all are different when it comes to OSCE. So I want to pick up
Definitely.
those points and hands in hands take you forward to a point where you are smooth, your flow is perfect, and you know the content which you guys have to speak. Kishwar, I can see you guys privately trying to encourage Rosina, you. So, but what do you think is the main thing which you would like in OSCE to get addressed, or the fear, or I would say that maybe something which you want to stress upon more?
Just how to present crisp, just how to present crisp to the point so that we get the exact
True,
marks that we need. Because we all are
yes,
reading the same material, but how to
true.
present it so that we can, succeed better. Because with the work schedule, our time, study time is also very less. So getting
True.
more out of all that, and how to like
Absolutely.
upload the videos or the voice messages, like exactly what is expected out of us.
Absolutely. This is after 1 to 2 sessions, you guys would be so clear on. Reason for that is that at times, unfortunately, we speak for 10 minutes, but unfortunately, we don't match to the scorecard. So the most important thing is that you know the requirement of the station. And that's what I'm going to teach you about. That you should know what's the agenda provided to you guys. You should know that what are the things which are expected from you guys. And that would make you. Examiner cannot do anything except can mark you tick, 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 tick. Right? And if it is done beautifully, if you know that what the station is all about, things are going to be easy for you guys. And that's what I'm going to stress upon. Hoyam, how are you doing today, my dear?
Hi, ma'am. How are you? Good morning. Salam
I am
alaikum.
so happy to see you. I hope family is fine. Everything is
Al-
good. What
Alhamdulillah.
are your thoughts about OSCE? What are the apprehensions? What are the points where you need to focus more? Let me know.
No, inshallah, everything will be okay. We are know that we are in a good hands, inshallah, and everything will go well. The very thing only we are afraid because we don't have much experience before, like our friends or this one who can ask or who can practice with them this MRCBI like MRCOG. I feel we are clear with MRCOG stations and this one, but for MRCBI, I feel like it is not too much clear. We don't have good grip on these issues.
Okay.
Maybe we know the topics, we know everything, but we don't have good grip on how to present this structured discussion or long cases or this one examination, the mannequin, how to examine, how to deal with this one. Some fear we know the topic, but we don't have to. I can't start on day 6. I cannot start because I don't know what is going on. I don't have experience with this one. You get my
I
point?
I
So
totally
this is our concern.
Absolutely. I am going to work on this, and you would see after 2 sessions, you will be telling me that, ma'am, now I understand what I have to speak and I'm
Yes,
preparing well.
I am sure that I am trusting you guys, and I am very happy to be one of the family of the RFA team.
Thank you so much. My pleasure, my responsibility. Why I'm noticing this, and for you guys, it might be just, giving your views. For me, I always, for every course, I make my folder, I make my points, and then I evaluate myself as a mentor that, okay, this point is done. Now I feel that my students have understood this. And once your basal level queries would be done, we'll talk again that, a step ahead. Maybe, a difficulty level would be more, and that would be better that now, ma'am, this is what we are facing because we have started preparation now. So we would keep on analyzing ourselves that where we are in the journey and how we are going to be better. Queries will keep on coming, we'll solve them, we'll address them again, and reaching to the top. That would be the point where you people would be prepared perfectly. Mariam, you want to say something, please? You've raised your hand. I can't see you. Maybe in the morning bed. Yes, Mariam? How are
Good
you doing, sweetie?
morning.
Very much. You're all set?
I'm on duty actually.
No worries at all.
Yeah, how are
Please, I can
you?
understand. I'm
Hope
good.
you're
Thank you
well.
so much. Thank you very
Um,
much. What do you want to say, my
First,
love?
my concern is regarding the preparation itself. Actually, for
Okay.
my part too, I depended on your slides, your classes, because I decided a short period to give. So now I'm really confused where to start from, how to start. Shall I concentrate again on your live sessions and those topics to start with? Or like till now, I did not start studying because I feel it's so huge. Where to start from, Is your portal enough, or shall I start mainly with your cases and then go to the others?
Okay. Noted, please. Every single question, you'll get an answer, and you'll be
Thank you
super
so
clear
much.
about this at the end of the session. Okay?
Thank you.
Thank you very much. Thank you. Anybody wants to add on something else? Anybody wants to add on with some sort of a query which you think that is the basic thing that's disturbing you guys? The thoughts, Rosina, my dear, you wanted to say something. Listened to your voice note. I was in the fast track session yesterday, so I thought that I'll be getting back to you, please. So the thoughts which are disturbing are the same, right? How to present the structured discussion, Rosina? This was your query yesterday. I got your message. Are you there? Oh, I think Rosina got disconnected. Okay, she'll be joining in a bit. All right. Kishwar, you can share the link in that OSCE private group where you guys, Rosina is here. The link of the session, webinar.
Okay, ma'am, I will.
Thank you, my love. Thank you very much. All right, Tura wants to say something. How are you doing
Yes,
today,
ma'am.
Tura? How are you?
Hi, mom. Good morning.
Good morning, sweetie. How are you?
Yeah, I'm fine, alhamdulillah. Mom,
Yes,
first
let
of
me
all,
know what are the queries.
thank you for effort as usual. But I want to guide us how to start because still I'm try and listen a lot, but still I feel confusing. Sometimes when I think this is a long case or short cases, I have a
True.
little bit confused. Maybe I spend a lot with the history and missing
Yeah,
some. Sometimes
yeah.
I don't know. Even with the last week, the topics that we are have in like sickle cell disease, when I try
Hmm.
to show in the portal, some patient come with a crisis, some in the early pregnancy. So as try to start, should I make them, and from where can I get this case, the name of the case? Is there something I'm missing? Still, I want to guide you step by step, please, mom,
Got
because
it. Absolutely. Absolutely. That's what I'm here for. That's what we're meeting at the morning
yes, ma'am.
breakfast today. So don't worry at all. Thank you so
Thank you
much,
so much.
Sura. Point
Thank
noted,
you.
please. And I'll tell you specific and then you'll be very clear at the end of the session. Rosina. Yes, my love. I listened to your voice note. Saba wants to say something, Rosina, before you. Yes, Saba, you wanted to say something.
Yes,
Yes,
ma'am, the same question as regarding SPT and structure discussion. What
Hmm.
I'm getting like SPT, a patient will be there and we have to do a conversation in short. And regarding the structure discussion, we will have questions in front of us. And or the examiner will ask the question and we will reply in detail turn by turn. Is it?
Okay, perfect. All
Ma'am,
right, noted,
Ma'am,
please.
yeah, one request is when the cases like are shared in the group for SD, like of course I will request Ma'am Binte Hawa to share the questions also. I put in the group also to share the
Okay.
questions so that we record accordingly while replying these questions if it is SD. And of course we will miss out the things in the start. That's why we are here. Hope inshallah, all of us will
Not
improve
a
quickly.
problem at all. Not a problem at all. I totally understand that. Lucinda, you wanted to add on something. I listened to your voice note though, but still, I would like to know that the problem was between ST, SPT, how much is the content, and how to do the time management, please. Am I right? Please go ahead.
Yeah.
Yes.
Yes, ma'am. Actually, when I went to be the case presentation, I was, little, I take too much time because supposed to be it is the 9 minutes or 7.
I didn't
But
listen to your recordings, but I saw the time. When I saw 13, 14 minutes, I said, girl, oh my God, 14 minutes recording you're putting in, and this would be half of the next station time.
yes,
I saw that 40 minutes, girl, 14 minutes recording you're putting in. Okay, yes.
because I was confused because when I went to be the long cases, I thought to be, I know about the long cases, I had the enough time. But when I went to the SDR, the structured discussion or the short cases, I was confused because when I'm going to be the I went to be the more than enough, that's why I confused. And I ask you and send you the message because I want to be the no per and especially to be which question should I will go to the short cases. First of all, this one. It means the which question is very necessary. We should not miss in the exam and where is the deficiency I don't want to be the lose my exam, so I want to be the perfection of the especially the ST and the short cases.
Absolutely understood, my dear. Okay, so I'll tell you exactly the differences, and you people will be perfect in this just as we go forward with the session today. All right. So, idea of meeting today, everyone. Before that, I would like to ask if anybody has any other question, please. Anything which you guys want me to address today, I'm happy to take it. If anybody wants to say something, please let me know. Saira Liaquat, my love.
Assalamu
Saira,
alaikum, ma'am. Assalamu alaikum, ma'am. How are you?
Assalam, my dearest
Ma'am, nice
Anna.
to see you.
Thank you so much. Always a pleasure
Uh,
meeting you guys, my dear. Please. So, are you
thank you,
in the
ma'am.
morning bed? Still in bed?
Yes, ma'am. Yes.
No worries at all. Okay, let me know.
Ma'am, I had a concern that the topic which is uploaded in the group, that you have this topic today, daily topics which are uploading in the group. We have to cover the whole topic in each in respect to every aspect, or we have to just cover that aspect of the topic. Ma'am, I am concerned that, for example, we have the case of breach presentation in the uploaded yesterday. We have to cover breach in each and every aspect, or we have to just cover the aspect which is uploaded in the group. I'm concerned regarding this because it is very difficult in a one day to cover one topic in each and every aspect.
Got
Ma'am,
it.
I had
Got
this
your
query.
question. Got it. Got the question. Note it down. I'll address that and keep in mind when I'm explaining how to prepare well.
Thank you.
Okay.
Thank
Thank
you,
you very much,
ma'am.
Sarah. Anything else?
Dr. Sidra,
Anything else?
assalamu alaikum.
Walaikum
Assalamu alaikum.
assalam. So happy to see you, my dear. God bless you. Lots of prayers. Thank you very much. I also want coffee, girl. Morning
Please
coffee.
have it.
Yes, give me through the Zoom.
Dr. Sidra,
Yes, my
I
dear.
want to ask you what is circuit 1 and 2, what all things we will cover in that?
Circuit 1 and 2, as in?
Circuit 1, circuit 2, you have given the schedule na? On 15th of June, there is circuit 1. What all things?
Okay. Live sessions.
Yeah, live sessions.
Okay, Deepa, note it, please. Okay, perfect. Live sessions, circuits. Okay. All right. So, anybody wants to say anything? Because then it would be mentors' time and mentees' time to listen to. So, please let me know if mentees want to say anything else before I start speaking. Anything else in your mind, please? I'm happy to listen to. Then we are going to start with the session. Hi, Tanya. How are you?
Assalamu alaikum, ma'am.
You're mute. Hello, Omar. At least one boy in girls, and that too without camera. Don't feel shy, boy. Omar, you have
I
to
have a
fight with these
question.
girls, yeah? How are you doing, Omar?
I am fine, ma'am. Thank you.
Good to see you, my dearest. How are you doing?
I'm fine, thank you.
Please let me know. Any concerns, Omar? I hope they're not giving you tough time. They give you time to speak also. I know when lots of girls are there, boys, they
Yes,
are silent like
too many
anything.
girls, really.
Yeah? So you
Too
alone
many.
should be heavier on them, isn't it? In the group.
No
Yeah?
problem. Yes, I
Please
was
tell me.
really waiting for this session, really, because I'm feeling really lost. I feel part three to be more easy than part two, but when I started to study for this exam, I find it really different from part two. My really concern about the Telegram group, really, because I feel the mentors there deal like we already know everything about that exam. I really
Yes,
started.
because Omar, sessions are not started. That's why you feel this way. I mean, it's so natural to feel this way when you have not started the preparation. Don't
Yes,
worry at all.
yes,
Yeah.
yes. I found some colleagues there really started and
Good.
give their feedback audio records. يعني we need like guidance, the template, how to do it. I'm concerned. يعني I focused on the clinical practice. I found it is okay, but how to present or how to make myself to put the information together, it's really a need to guide.
Absolutely. Absolutely. This is what I'm here for. And today I'm going to take you from the baby steps. No matter
Yes.
somebody knows something,
Yes,
no
baby
matter
steps.
somebody doesn't know anything, I will take you as if nobody knows anything. Maybe it's a repetition for you guys, but we'll start from the bases and make the blocks in the building. Okay? All right?
Okay.
So don't
Thank you,
worry at
ma'am.
all. I totally understand. Feeling lost in the beginning is absolutely normal. It's nothing abnormal. It's very natural and very normal. Okay? Homera, you want to say something before we start? I think your query is MRCOT, MRCPI
Yes,
together.
ma'am, yes, you are very right.
I will
You
take.
know us very well. Assalamu alaikum, ma'am. Basically, I am confused whether I can take these two exams together in November, MRCUG 3 and MRCPI. Can I mix up, or you know my query
No.
since the first day I was mixing up
Not mix up anything. Don't worry. I've seen students passing with a 5 days gap of MRCOG, Shito from India, MRCOG
Yes.
3, EPCOC, and MRCPI, all three in November. And the previous exams, and all three passing. So do not worry at all. Absolutely, you don't have to worry.
I will try my
Okay?
best, ma'am, but I
You
need
will.
a guidance.
I would tell you
Inshallah.
the differences and how you have to just structure yourself in the end. Do you understand? Yep. Okay,
Yes.
perfect.
Okay.
Okay, that's great. All right. So are we happy to give mentor a little time to speak now? I have taken a list here. I will keep these things in mind, and then we are going to start up one by one. Is that okay?
Okay,
Yes? Anything comes in mind, please do not hesitate to drop in. I've got the chat in front of me, and we're going to make it interactive. All right. So a formal welcome to all of you today for the starting of the MRCPI OSCE. First step today to meet up is to understand what MRCPI OSCE is all about, what people had been doing earlier, what is expected out of you. And the first thing that comes up in your mind is how much time is enough for MRCPI OSCE. I'm here today to tell you exactly that what people had been doing, or when somebody is having some more hospital routine difficulties, or for that matter, some household difficulties, kids' exams all over going on in this season, lots of things in life. But we need to understand that generally how much time is needed. I would not like to make you guys overconfident, but would like to tell you that out of all the OSCEs, if I compare obstetrics and gynecology, all the OSCEs in the world, comparatively, the Irish College OSCE is comparatively easier. That does not mean that we don't have to study. We definitely have to reach to a level that we have to clear this exam in one go. But it is comparatively easier, smaller, and lesser content. Okay? Students generally do it. It's just now after COVID that these gaps are more, and there have been some space out. Students have been doing this immediately after the theory exam in 2 months' time. If you go to testimonial of Nadia Liaquat, many of you know her from the part 2 as well. It was just hardly 30 days, in fact 25 days, when the confirmation came. Day and night working. You can just see her in this one as well when she passed. So this OSCE, when she came, and she was blank absolutely, because the mock exam was the first thing where she was picking up, because she had not taken any OSCE, and she always gives this example that I was like not knowing anything, but at that time I just got the clue that how I have to move further with the OSCE preparation. I would say generally, if you're giving 6 hours minimum, 2 months are enough. So if you keep this in mind, if the month of June, July, August, September, October, we've got a good amount of 4 months, and it's absolutely sufficient. Absolutely sufficient if you are preparing today. Nobody can beat you in completing your content. Nobody can beat you in just being focused and targeted, and you all can make this in one go. That's number one. We are not late. We are starting, I think, before time. But what I need, the mental state, the harmony from you guys is, do not feel that we'll start picking up books in August or September. Today, I don't want whole day, but I want 2.5 hours daily. That's the minimum I need for this month, June, July. 2 hours, 2.5 hours. That's it. And I think out of 24 hours, I can expect this from you guys. Can I? Give me in the dining table. Give me any time in the labor ward with your midwife. Give me any time, but I want 2.5 hours from you guys from today. That's my requirement, which you people would have to give me, and I'll tell you what you have to do from this. Omar, are you there? Yes, we all are busy, but out of 24 hours, I am giving you guys 22 hours, 2 hours are mine. Noted? This is for June and July. In August, I'll be asking more time. Okay? So the 2 months, I'm asking 2.5 hours. That's it. This is for now. We have to make it a success till that point. Okay? Till October, we have to start our revision. Now, you have so many people. All the Oman, can you see all these students in Oman mock exam? Every single student in this picture is MRCPI today, right? So why is this? Because they have had the steps. They had their premium, they had their fast track, they had their OSCE hands-on. Nothing would be a difficulty provided you just build up step by step, as I tell you. Make your basis strong, and if anything is there, people came from Jordan, they came from states, all the way from America, from India, from lots of places you can see here. But it's just about, they all had this day today, which you guys are having, intro, where they did feel that we are lost, we are having shortcomings, we have difficulties, and none of them in the intro session said before passing this exam, we know everything. So we all pass through this. We all face these difficulties. We all have the thoughts of how would we do that? That's the reason. My starting point for you guys is knowing those apprehensions which are disturbing you guys, so that I can address, and the mental state, we be on one page, and we are all on actually the targeted start, which I want from you guys in the very start. They had scored so much in the last exam. Of course, we've got the February results so far, the May is expected. They scored highest out of more than 80%. And you guys know that because of the collaborations, I've got Irish students so much because for them, it's a necessity to do this MRCPI. And they've had tremendous results all around the globe. This is just to give you that feel that it is something doable. It is not something where we get so many failures. Exceptions are there, but then if you make big blunders, I always say the passing rate is higher and we need to maintain that passing rate together. So with the rising sun and the bright shine, I expect you guys to make it a success. Keep on listening to this intro. Keep on listening to the motivation. Do not get easy in this journey. 2-3 hours is not a tough time, but learn that we have to make it a success. Target this success. And the date which we are targeting is November 2024, for which we have the openings on 7th of August. The exact date by college is to be communicated later, but around 7th of August, you guys would be filling in and paying for the exam. I get the question that like part 2 written, we need to prepare some documents, ma'am. The answer is no. We do not need any document here. If you've passed your MRCPI written, you will get the invitation for doing. The only thing is that you have to accept that, yes, you want to take this exam, and the payment would be taken with you, but there is a chance that you might not get in first go. In the second go, again, they have a cycle, and in the third go, again, they have a cycle. So please understand that even if you don't get the acceptance in the first, there is a chance that till 1 month before exam, you might get an acceptance. They keep on sending emails, and you should be ready to get acceptance anytime in this point. All right? So please keep a note of that in exam. November has to be a successful attempt. We are expecting the February as well. Any of you who doesn't get a seat, please don't get disheartened because it's just a matter of December and January. In February, we are expecting the exam again in the Gulf, and that would be in overseas, not in Ireland. Okay? Am I clear about the target which we have? Am I clear about the target which we have? I'm going to go step by step. The aim which we are doing at the moment is November 2024. Everybody clear? Yes? So far you're clear that what is the exam aim we are targeting? If you don't get seat in November, do not get disheartened. Just in a matter of 1.5 months, you'll get the next exam. Okay, but for now, we all are aiming for November 2024. Now, about MRCPI OSCE, we have 2 parts of written exam. The written exam, once it's done, you get that part 2 exam has got further 2 parts, a written and an OSCE. So when you have your written exam, you get eligible for the OSCE exam, like you guys are meeting me today. After passing written exam, you have to get ready for the OSCE, which is speaking and nothing written. Right? Speaking and nothing is written there. Difference between the European boards and the MRCPI 3 is that in MRCPI, you've got 2 divisions, a morning division and an afternoon division. When I say division of exam, one is a circuit and the other is basically going to be a long case, which is slightly different to what you guys have learned in different stations or attended. First, you guys have to understand that what is the criteria of passing this exam. You all have to understand that when we are taking this exam, it is long case. Everyone has to appear in one long case, please. One long case everyone has to appear in. Now, It can be a gynec long case. It can be an obstetric long case. Are you guys with me? Are you guys with me? We don't have 2 long cases, please. I need your attention. 1 long case. In exam, there is a possibility that the long case is in the morning. You start your exam at 8:30, next session 10:30, 11:30, 12:30, different groups, they start from the beginning. Each group has around 8 students, 8 candidates. They start in the cubicles. One is getting gynae, next cubicle obs, gynec, obs, gynec, obs, gynec, obs. Randomly. Okay, randomly. Farhana, go to cubicle number 1, right? You are candidate number 1. So, Rosina, cubicle number 2. Kishwar, cubicle number 3. When you go inside and you have an instructions on the table, there's a table inside and the instructions on the table are there. They tell you that you are in obstetrics or you're in gynae. Saira, log out and log in again, my dear. Screen is visible, sweetheart. Do you guys understand? When you read on the table, you come to know, all right, I've got a preeclampsia. Okay, I've got HMB. Outside the cubicle, you do not know. Is this point clear? Right? So, no other long case. Why am I emphasizing so much no other long case? Reason for that is, 1 long case means that you have to pass that long case. You don't have a second long case to cover up your score. Do you guys understand this point? Do you guys understand this point? 1 long case, 25 minutes, and that has to be passed. It has to be a passing long case because we do not have anything else. No other long case. Long case has to be separately passed. Circuit has to be separately passed. Is this point clear? Right? In long case, because it's 25 minutes, you have 2 exams. The first part is being assessed and evaluated by the first one, and the second part, the second half of the long case is by the second examiner. Okay? Now, I always say when the long case starts, your first part, because the second examiner is also listening to, comes to know is a passing candidate or not. When you listen to someone, just tell me, you guys listen to someone in the study group, you're like, yes, this girl, this boy has the spark. Do you guys agree? We make our some sort of an evaluation and judgment, isn't it? This actually means that your starting of the long case has to be very confident, perfect, and you should know that what is being done. Now, I would tell you guys that in the long case, how the markings are divided, so you exactly know what is expected from you guys. In the long case, this is the table. This is the examination couch. 2 examiners are sitting. You are here. Role player is here. Examiner 1, examiner 2, candidate, and the role player. You enter into the cubicle, you sit down, generally legs are this side because you and role player are facing towards each other, especially when you're doing the history take. The candidate instructions would be here on the table, which would not be longer, 4 or 5 lines, or maybe 5, 6 lines to tell you about the case, to tell you about what is the case. You enter into the cubicle, you introduce yourself, and you read, hello, I'm Dr. Farhana. I'm one of the candidates for today. Small greeting, whatever greeting you want to do. Slight smile on your face, showing the confidence, and you are asked to sit down. You read the instructions, and your 25 minutes start. The composition of the long case which you guys have is history, examination, they might ask you differential diagnosis on the basis of history examination. They might not ask you, depending upon the case, if it's a diagnosed case. Investigation, treatment plan. In treatment plan, they might ask you, explain the condition to the patient as well. Now, till history examination, your first examiner is responsible to mark you. And from investigation treatment, the questions about the viva, about the topic, would be examiner number 2 marking you. I always say that passing the long case means that every section should be perfect. If you see the scorecard goes like this: history, examination, investigation, pass, borderline, fail. Do you guys understand? History passing, examination passing, investigation passing, questions all doing fine. Are you guys with me? Every single section has to be passing. If 1 or 2 goes borderline, that puts you somewhere in a little difficult position. You know, you go out and the examiners talk amongst themselves. I mean, how big was the mistake? Are we able to, because her investigations were super good, or maybe the history was very good, she had a fumbling or a little shaky attire in the examination, are we able to cover it up? If your history is perfect, examination is perfect, differentials are perfect, investigation is perfect, your treatment is patient-safe, you answer all the questions, your job is done. You guys have a problem in the time management, and everybody's saying, I am so easy in the long case because I've got so much time. Only the circuit is a problem. It's unfortunately not the case. Long case also needs a very good time, because every section has to get completed. I mean, I always say divide 25 by 2, everyone around 12.5 minutes, your history examination should be done. Your investigation treatment plan till the second examiner, 12.5 minutes. And at times we expand so much that we lose the score here. We have to be very clear in understanding every single sequence. If your history is good, you've already made the basis strong of passing the long case. So I always stress upon the history so much. I give so many mnemonics. I give so many connections of the HOPIs, because if your history is not good, you don't make a strong basis. You might lose certain points which would have a difficulty in the management. A strong history is the basis of passing the long case. Are you guys with me? Are you guys with me? And this is a set pattern of the long case. Pattern of the long case. The first 2 parts with examiner number 1, the second 2 parts with examiner number 2. And when we were taking our exams, we used to have a bell in half of the long case. And, you know, the coordinator used to say, half time over, please. But in the recent exam in Ireland, they didn't have the bell. So it's okay. At times it can be a bell. At times it cannot be a bell. So please take care of that. Okay? Yes, Thura. When you do the history, when you take a history, I'll do the first long case session. You guys would perfectly be understanding Thura. You face towards the patient, Thura. You take the history, right? And after history taking, you're done with history taking. You face back to the examiner. Examiner may ask, please summarize your case. You summarize the important points of the case. I'll teach you how to do a summary. You'll be perfect. My students are awesome in summary when it comes to the last part. Hello, Anila. How are you doing, my dear? Thank you very much for joining in. So they're very, very strong in that. Once you do a summary, the examiner takes you to the couch on the side here, and they ask you to examine on a mannequin. There can be a mannequin there, obstetric examination or gynec examination, that I'll teach you everything. Once the examination is done, you'll come back on your chair again. You'll come back to the seat and you will have the next discussion, which is on the basis of your history examination, what investigations are needed. You will justify the investigations, then you will make a treatment plan, and then last 5 to 7 minutes are questions, the viva questions from the case. Farheen, no. The same day, everyone, please listen to me very carefully. The same day, same cases are happening. One obstetric, one gynae. It's not that everybody gets a different case. If Farhana is getting an obstetric, all those who are getting obstetric will get the same case. All those who are getting the gynae will get the same case. Hello, Iman. So good to see you. Do you guys understand? There are 2 cases in a day, only 2 cases. On day 1 exam, 2 cases. On day 2 exam, 2 cases. One obstetric, one gynae. The whole day those cases tend to happen. But you guys cannot discuss, because the ones who have done the long case, they are separate, and the ones who are yet to do the long case, they are separate. So nobody knows till the end of the exam. Am I clear? Nobody can choose. Randomly, you are told to go to the cubicles and take your long case. Is this point clear? Absolutely, Humaira, it's luck. But very expected stations come, honestly. It's just about being composed from day 1. Yes? Now, how to take the history, how to do a perfect examination, how to make your differentials, how to justify investigations, how to find a perfect patient-safe treatment plan, and how to answer the question is my job to teach. Once you'll attend the session, you will understand. Like Kishore was asking, what is going to be in the circuits, what's going to be in the live session. Circuits are going to be cases of the circuit, and long case, I'm going to do long cases with you guys. In each session, I'm going to cover 4 long cases, 2 obstetrics, 2 gynae. After the first long case session, I would make you guys just on the right track. Just give me time till first long case, and you guys would exactly know that what you have to do in the long case in specific points. I've given you the outline. Then I would polish you guys that where exactly we go wrong. Why we lose in the long case? Because we miss our points. Karima, absolutely. Absolutely. You all have on exam on this table, please, here, an A4 sheet. And you can write your points on the A4 sheet. How you have to write, if you go to my my mock picture albums, you guys see me on the flip chart? Do you guys see me on the flip chart? So many times there are pictures on the flip chart, writing something, and there's a complete pad in Ireland. I always tell that how you have to make your page so that you don't miss out anything. If you just go to the page now, you'll see so many pictures there that I exactly tell you guys what I used to do for myself to organize my page. And I will tell you how to make a history sheet in the mock exams. I'm always very strict on this, that you guys are putting into things in your blocks. Is that clear? But everything would be step by step. All right? Everything would be step by step. A Facebook page, Deepa. Facebook page. Go to the Facebook page, go to the Ireland album, go to the Riyadh album, the recent mocks. You'll see that how I'm using the flip charts there. But I would definitely teach you guys as well, not a problem. Everything would be there for you guys. I'm just telling you that how sequential we have to go further. I don't want scribbles on the page. I don't want, kids doodling on at the end of the day, students say, Ma'am, I wrote BMI, but I just forgot to speak. I said, the way you have written the BMI, we all are humans. Yes, we will forget. So there's a way to organize the page. There's a way to present. That's what I'm here for. And that's what I'm going to teach you guys. Okay. The outline of the long case, is this clear to you guys? The outline of the long case, is it clear to you guys? Any question from the long case, apart from what content we have to prepare, of course, that's I'm going to teach you guys. With the outline, how the long case goes, please. I'm happy to take question if any long case question in terms of outline is there, please. You can open up your cameras. Please be free to ask any question at all if it's coming up in your mind. Please. Yes. It's clear, Tura? No, please. If anything is there, Kishwar, the outline of the long case, how the marking is there, how it's done. Is it clear to you guys? How do you assign? Now, this exam, long cases were first in the morning. It started, and the circuit was in the afternoon. And for the last exam, it was vice versa. I mean, the long cases were circuit. So it's absolutely, college sends an email around 15-20 days before, and you exactly know that long case is in the morning or circuit is in the morning. Okay, so you know your pattern, but they keep on changing depending upon the administrative things. Clear, everybody? Yes, the long case outline is clear. One long case, everyone, not a problem. It's not an exhaustive exam at all. So Moona says we can write in the paper small note when we are taking history. Absolutely, Moona. I would tell you that how you have to write, and you can write. My way was very clear. You know, Moona, it looks a little offensive or embarrassing for the patient, like you're talking to the patient, but you're not listening to the patient. It is difficult in the clinic as well, you know. So I used to start my long case this way. While talking to you, is that okay that I take few points? So she says yes. So, you know, you take a permission that it's okay that I take some important points while asking history. She says, yes, please. So this is a good communication way. We start writing. Okay, important points, of course. Yes, Hoya, you wanted to say something. Homera, you were saying something, please. Yeah, you're mute, Hoya.
Yeah, I want to ask when I go to the mannequin, I will tell the examiner that I will do this one, I will examine this one, I will see the patient, I will see the general condition of the patient, I will see the pallor, or I will do real examination.
You are being assessed in the examination to do examination with your hands, your steps. But generally, they do not do the general physical examination, the vitals, the blood pressure. The basic commands, if you want to know, I can teach you today. Otherwise, it's in my sessions everywhere. You can write it down, everyone. The basic things which are to be done in the exam for the examination are in obstetrics. They give you obstetric examination command, which is all the Leopold's maneuver, everything. They don't give you general physical examination, but you have to speak general physical, but I will teach you how you have to speak that. In obstetric, only speculum comes when it's a rupture of membrane case, which is hardly one case in the past exam. Then vaginal examination, only in 2 cases you do in exam. One in induction of labor, when you have to assess the bishop, only then I allow students, or it's a labeling wish to assess the state. Rest, in 90% of the cases, in obstetric case, you just have to do obstetric examination. What is that? Inspection, palpation, in palpation, all the Leopold's maneuver, auscultation, that's it. Okay? But, Hoya, you have to do that with your hands. They're seeing your steps.
Okay.
In Gynac. In Gynac, I always give you the list in the long case session because you have asked this question, so I'll tell you today that it's generally in Gynac, you get the mass examination, pelvic mass examination, like a fibroid, like ovarian cancer. So, you know, inspection, palpation, the size of the mass, percussion, you take an intrastate, temperature, hot, cold, everything, you know, this is how the mass, and everything is on the portal. Every examination points are on the portal. You just have to cram them up. Every single thing is with you guys. Then with mass, you get a Gynac examination, which is abdominal examination, inspection, palpation, percussion. In ovarian cancer, the percussion also comes for the ascitic fluid, okay? And then they give you the speculum examination very commonly. And during speculum examination, you always get a command, please take a pap smear 3 times. High vaginal swab, from where to take the swabs. I always teach practically from where to take the swabs, from where to take the smears. All these things are very important. And the last one, which is it by manual and vaginal examination, especially fibroid cases and all, meiosis, they always want to do by manual. Claire, this is the general examination. If you know this, your second section is done. Claire?
Okay, thank you, ma'am. Thank you. Yeah,
No
thank you.
worries.
Thank you.
Manahil has a question. Do we have real patients? Manahil, before COVID, we used to have, but after COVID, there are no real patients till date. Only mannequins are there and the dummies are there. That's it. Okay. But the findings might be there. Like, if you see my Ireland pictures, if you see that, I had all the mannequins with the findings. There was an ovarian cyst, all those who'll see me in Ireland, a mock exam. The cyst was there and the fibroid was there. So findings might be there. So it's not that mannequins, they don't have the findings. Even the breech long case, put the baby as breech. Okay. So you can. And then they'll give you the findings. So of course they have to give you the findings to move the long case further if findings are not there. But your steps are being assessed in examination. You hardly have 3 to 4 minutes for that. Only 4 minutes for examination.
Excuse me, ma'am.
Yes, my dear Sabha.
Ma'am, for the speculum examination on mannequin, we will just explain it. We will hold the speculum that we are introducing it like this.
You have to do it. There's
Okay,
a
and the pap
complete
smear also we will take.
Yes,
From
smears
inside.
are
Okay.
there. Yes, you have to take. And that's what I make you practice, Sabha. Every single thing I put in the mod so that you repeatedly do that. So there's no confusion and you don't have any problem.
Sure, ma'am. Thank you so much. Thank you.
Anila, you wanted to say something? Anila, you had a
Hello,
query, please.
Assalamualaikum.
Walaikum assalam, please.
I just wanted to ask you because, sorry for my voice, I had just traveled yesterday. So I just wanted to ask that for the long case, as I have done my FCPS, I had already done the long case there. But the thing is that we used to have a patient. Real patient is a different thing. So whenever we take the history and we do the examination, we don't do like there is no interruption in between. And when we finish the examination, then we had some DDs in our mind as a candidate, and then we like sit for the investigation and everything, and then we go. Sorry, something happened. So then we go for the examiner, and then he will ask us that what is your provisional diagnosis and what are your DDs, whatever, so on. But here the thing is different. As the patient is not there, there is only a role player. So like that imagination get different a lot. So when you sit with the role player, you talk to her and whatever happened, like you done all the history and everything. Then you go to the mannequin and then you have to pretend like it's a patient. So like these things, these gaps make you very, very confused because like you have to say that I'm going to examine you. Are you going to get discomforted? Are you going to tell me? And obviously we are not going to get any finding in that thing. So that make your mind a lot different. And uh, which my perspective is that I think that after doing that, that is just a show, like you have to pretend that you know the examination. You have to just show the skills and then you sit for the like investigations and whatsoever. But the briefing which we do tell the patient, which we usually do after we make the DD on the basis of the examination and investigations, that briefing when we have to tell the patient, because here we can't find anything in an examination because the patient is not a real patient. And other thing is that we don't have an investigation yet. So, so the small briefing which we have to tell the patient that you have got this and this, and we are going to plan accordingly. So, most probably you got this and that, whatever options. When we have to tell that, or we have to wait for the examiner, that examiner will ask us that go ahead and tell the patient that this is your finding and now this is the way you have to present, and this is the management what we are going to do with you.
Done. I mean, this is the query which you have. Yeah.
One of the query.
One of the query. No problem. My pleasure. All right. So Anila, first thing I would like to tell all of you is that it's not always 100% that it's a show only. At times, the mannequin does have finding, but depending upon the venue. In Riyadh, they don't have all the findings because there are multiple cubicles, right? So maybe there's like one mannequin with findings, but others they don't get in different cubicles because, of course, there's like administratively, it's very difficult to get so many mannequins with the findings, with the same long case findings. So there is a chance that the findings might not be there. There is a chance that the findings might be there. You have to do the steps properly. Examination is about knowing that, yes, if you're doing the lateral grip, where it is. If you're doing the fundal grip, you should be knowing that where it is. Okay? What are the significance of that? Where do we listen to the fetal heart? Where it is. So if your findings and your way of doing the examination is fine, you get the score. You guys might be thinking, like Anila is saying, that exactly, very, very well done, Karima. You might be thinking that it's a show and it's difficult that we are acting. But if I make you see the other side of the picture, you people will be thankful. When the findings and the patient is there and it's a real patient and you don't find it, the failure risk is and the chances are so high. You guys are lucky that you've got mannequins. Anila, would you agree? If you don't get an IUFD and you listen to the fetal heart and you say, I've listened to the fetal heart, the whole long case is gone. Do you guys understand? It's a blessing in disguise that mannequin is there. This gives, from the student's perspective, it's a positive thing in terms of expertise, because many are not good clinically. Hana, many have not seen the biomanual examination of cyst, and many have not seen that, okay, we are going to get the right adnexal fullness. And if you don't find it, saying that I will do the biomanual examination to see the fullness on the adnexa and finding is very different. You know that you have to see it, you will say and you will pass that yes, you have got a vision for it. But if you don't find it, it's a real patient, Anila, it would be very difficult and the failure used to be higher on this. So it's somehow a thing for which you should be confident rather than being shaky. This is a mentor's perspective I'm giving you. You get it? So be positive on this. It's a blessing at the moment. If they change this, it would be a trouble. More of the patients, more of the findings back to back, we'll have to search because everybody is not very good clinically. They don't have too much of exposures. You understand? That's number one. Number two is that your examination, when it doesn't have a finding, so they know if it doesn't have a finding, you just have to be good in your steps. You should know how we examine. That's it. For example, I'm very strict when students are doing inspection. They're like, okay, I'm seeing the abdomen. I said, no, come to the level, go on the side. I make them go on the foot end. I make sure that they do full acting. You understand, Anila? So these are the things which are giving you score, sweetheart. All right? These are the things which are helping you. Whenever any student in front of me, does the inspection, that ma'am, I'm doing the inspection, I always say no, I will not pass on this inspection. If this is your table, please come to the level of the table. Please see from the side, go to the foot end, and then examiner is looking at you, your inspection is done. See? So there are tricks to pass the exam. There are tricks to impress the examiner, how you are doing your showcase. Simple. That is how the OSCE is. So don't worry. If findings are not there, they'll ask you to do abdominal examination. It's okay. When you come back, they'll give you the findings. I will give you my example. I had preeclampsia as a long case, okay? When I had preeclampsia as a long case, no blood pressure check was there. It was very quick. When I came back on my seat after doing everything, I asked the examiner, may I know the current blood pressure? She gave me. I asked about I said, was there any tenderness in the hypochondrium? She said, no, because I did it in the examination. You understand? But how would I know so that I can grade her as a severe preeclampsia or a mild preeclampsia, or in that situation, what would be my management? Because Anila, my management would vary. And then I could sense that I'm on the right direction. I asked her that, may I know her reflexes? Now, I don't have a knee there. I don't have an ankle there. It was a mannequin just of the abdomen. but I passed the reflexes. And I knew that she was marking me as a very good candidate because I could sense her expressions that I'm so focused. I'm sorry, I would like to know this because that would affect my management. So, I asked all these findings from her and she gave me. Understood? Understood, please?
Yes, I got it. But just one thing
Once
that
you've done this, Anila, once you have done this, you will ask the investigation. Once you make your diagnosis, the examiner would say, please tell your diagnosis to the patient. And many examiners might not say. It's not essential that every examiner says that. But once you know the diagnosis, then only you can explain. Definitely, they would not say, please tell to the patient the diagnosis once you have not reached. Okay? Got it?
And one more thing, the scenario which will be written for the long case, will they are going to write that she's a patient, she had a fibroid, or she has a mass, or whatever, and now she wanted to like plan for a pregnancy and she came here. That's it. And then we have to like do the long case and everything. But sometime like is it possibility that the long case would be written like this, or just there will be the station that this patient so and so and came here in your clinic, and that the single sentence thing.
At least 5 to 6 lines are there, scenarios.
It will be a scenario based, even in the log. Okay.
Scenario is given.
And what about the circuit? Because every circuit also.
I'm coming to the circuits. For
Okay.
long case, let's finish off so that if anything in the long case is there, then we move to the circuit. Any question? Anila, did I answer your query regarding the long cases, please? Whatever you were asking. I mean, it was a long question I was writing down, but I hope I didn't miss anything.
No, thank you.
It's clear? The long case thing is clear,
Yes,
which you
yes,
asked?
yes, yes.
Yeah?
Just patient briefing is my concern, because sometimes candidates with whoever I asked from, they used to tell that go to the patient, tell them, and talk to them for the contraception leaflet and everything, tell them everything. So in the long case as well, if somebody.
If asks you to talk to the patient, then yes. If it doesn't ask you, you don't have to go to the patient back.
That was my concern, because it will be
totally
going to
depends upon the
yes.
examiner, Anila, my dear. It totally depends upon the examiner.
Okay, that's why I did ask you, because I was unclear that whether we have to every time talk to patient or not. Because if we didn't talk to patient and they get the impression that they done so much and they didn't tell anything to the patient that you are getting this and you have this disease and we are going to plan like this and whether you want a surgery or not. But like I was thinking that way. So that's why I asked.
Depends upon the examiner. Examiner gives you the command, please talk to your patient and explain this to your patient.
Okay, because time is very short. That's why I asked that if I will going to ask the patient, tell the patient, and then my time will be like cut off for the management and everything. So because I would be stuck in the patient, and the many a time role player would be like,
Definitely guide you. They would not let you take too much time. They would not let you cross the time because they've got a key in front of them. So don't worry about this. Okay.
Thank you.
Okay, good girl. Thank you. Iba says,
Excuse me.
yes, my love. Yes, Thura.
In case of when I go to examine the long case, should I speak when I did the examination? Like I will take the vital sign and then I will make abdominal examination, start inspection, palpation, or no need to speak just to make that.
You get a command by the examiner, and the command is that please do an obstetrical examination. So
Okay.
then you do obstetrical examination. If the command is please do the relevant examination, then you do the relevant examination. It depends upon what basically command you get or what they ask you to do. Okay. So once you do that, you definitely go there and you speak some patient safety lines, which I will teach you guys. You have to write on your examination plan. And that lines are that I would stand on the right side of the patient, make sure that dignity and respect of my patient is there. Will I sanitize my hands and will make sure that the patient's bladder is empty. So these are some scoring lines which we speak just to make sure, and you be on the right side of the patient as well. And then if it's an abdominal examination, you tell about the exposure you need from the xephisternum till the pubic symphysis. And then you tell that, we'll cover up, always thank the patient and cover up the patient in the end. Students, they lose score in that. If your patient is uncovered, no matter if it's a maniquin, you have to cover up the maniquin, the white sheet. Sheet is given there.
Yeah,
you understand? And thank the role player.
Yeah, thank you.
These things are essential. And I have my checklist because we have not started the long case. When I'll do the long case, I'll give you my checklist. This. These 5 points you have to speak in this time. So, you are safe. And every examination, you have to speak these lines. When they ask you about the palpation, I always say, it's a very tiny thing, but always say that I'll make sure that my hands are warm, no matter you're in the hottest country. These are general ethics which contains score. Okay, so these type of things I teach you. When we'll come to the examination, I work on the long case, like making your history perfect, making your examination perfect, making your investigation way perfect, not doing unnecessary investigations and not missing the ones which you need, and then making a management plan which is focused to date till 2024. Seen so many students with so many older people they're doing, and they are doing the older recommendations. Now our CPI is changing so much. We need to be current. So many new things are there. So being patient safe as per recent examinations. Okay, so this is how I'm going to work on each section for you guys. All right. Any question, please, Deepa? We can give DT to the patient until final diagnosis after investigation. Not to the patient, Deepa. DD we give to the examiner. All right. DD we tell to the examiner. Examiner asks us, can I know that what are your differentials? Okay, after you come back from the examination, you give your differentials. For example, it's a pelvic mass DEBA. So you've got lots of differentials in your mind as per history. Okay, that also is a beauty. I always teach that, for example, the patient has got bleeding and heavy bleeding and an abdominal mass, right? So you say ovarian cyst first as a differential, and you say tubal mass second, and then you say fibroid and adeno. So I don't score you guys on this differential. No matter, you're fine. You've mentioned all the possibilities. I always score students that the differential, top most differential should be, which is a possible diagnosis. This is the vision of a good practitioner. When it's HMB and abdominal mass, I mean, the first thing should be fibroid, right? Not a cyst. I'm not saying that cyst can't be there. It can be there. But we should have our top differential, which shows your vision, your clinical, acumen. Okay? Examiner, what clinical finding? Yeah, that's fine. Okay. Any question from the long case, please? Before we go to, please, I'm here for the question.
Ma'am, they are giving a prolapse case. Prolapse case.
In the last 5 years, prolapse had not been there. However, SUI and OAB, overactive bladder and SUI, had been there. Prolapse examination didn't come. It came in the circuit, but examination is not coming. But I will teach you in fast track. I have that in the mock exams as well.
If they are giving, we need to pop few classifications according to the patient's symptoms.
I have this station in the long cases, don't worry.
Okay. Thank you.
I'll teach you. It's not that I'm teaching because it's a recall. I'm teaching if at all it comes. It is something if you have not done, you're not able to do. So we should know it, because it's a difficult examination. Up till now, it has not come. Okay? All right. Thank you very much. Okay, Mariam, you want to say something?
Yeah, just maybe we will learn it later, but in general, like if the long case, they put us like a case of emergencies, if she's bleeding or cardiac collapse, shall we take also all the history? Because in this condition, the patient will not be able to say about the general, like medical, previous surgical. Still, we have to take the full history if it is a long case.
Long case is all full history. Every section counts. Every section counts. You've got 7 minutes.
Emergency, she's prepared, she's disoriented. Like if they told us 1.5 liters.
EPH is never a long case.
Okay, all right.
Long cases are very stable long cases. The only unstable long case which we had was May 2023. That was second stage labor and instrumental birth. That was the only one where she was like too much in pain, and rest, they are cold cases. I won't say, I mean, these are the type of the cases which make you have 7 minutes. I mean, they're not in hell.
Okay, all right, thank you.
Okay, Mariam, thank you very much. Deepa, the fast track after the premium will start. Binte Hawa has allocated the dates around, I think, 1.5 months before exam, or the last 2. So basically, this regular would end up. But I think 3-4 students have already joined. But the fast track cases and the long and the premium cases, I keep them separate. All the recent stages I'm going to add there as well. So it's not a problem. And it's a little more rapid practice as squeezed in, as you have had the MRCPI Part 3 fast track, right? Like this. Okay. All right. Thank you very much. In each fast track, we do one paper. I mean, complete long cases, obstetrics, gynae, and then the 8th circuit. All right. So in each, Karima, regular makes your basis strong. It makes your, like it's from the starting up I'm taking. Fast track is, in each fast track, I will do one exam, one day. For example, I'll pick up Riyadh exam. I'll do the complete Riyadh exam. There are 8 circuits and 2 long cases, day 1, then day 2. So last 6 exams I do in the fast track. But in each fast track, 2 long cases we do, then 8 circuits we do, or 7 circuit stations we do. In premium, I do circuits separately to make your cases, long cases sessions separately, so that I build up your, So if you want to be active, then you can book now. If you want to be listener to get the cases and get the hang of it, at any time you can book after you get your seat confirmation. All right. But one more request, please. Mock reservations due in time. In Ireland, I had less of the active seats. Then, I had to make more circuits to accommodate in the end. In Riyadh also, in Oman, I had 42 students, so I had to keep so many circuits extra and increase the examiners then. So if you want to be active, then please on 100 USD registration, make sure that you book your Ireland or UAE. So I know the active participants and, because the circuit, it's lots of coordination, examiners, circuits, cubicles. So that I have to be very clear on prior because it becomes very difficult administratively to, do the active seats. Okay. So Humaira, never. It's never a center. The only center is Gulf and only is in Ireland. Saudi, Oman, UAE. These 3 are the exam centers from the Gulf so far and Ireland. That's it. Okay. Manahil. So no, our CPI, there's no point of doing that. Everybody has to travel Humaira. Everybody has to reach to the center, right? So when you reach to the center, there you will have the mock exam before the exam. Manahil mock date, please, we need to travel. So exactly when you'll reach Manahil, you'll be taking in UAE or you'll be taking in Ireland? Where would you be taking? UAE. Okay. So 2 to 3 days before exam, simple. Okay. Whatever would be the exam date, I want 48 hours before that. That's it. All right. Okay. Simple. So that is the easiest for everyone. I don't keep it, of course, on the last day because it's going to work the exam detail in detail. Rehana, I have told Rehana, Claire, Jasmine, Claire, my dear. So whenever you guys are traveling for exam, I need 48 hours before that so that you have complete one day to absorb it, do the hands-on, practice the skills and be there. Simple. So whatever would be the exam date, so 2 days before that, we'll keep mock exam. All right. Okay. That is the latest, closest to the exam I can keep for you guys so that traveling is not a problem. Is that okay? Do you guys agree with this? Last time it was, yeah, that's why I want you to book the seats because so many people are asking and I always get packed with the mock exams. Lena, generally last time it was some 20s date. Last year. Yeah, somewhere in 20s in the last 10 days. Right? Manahil, on the result. Now the result is expected on 14th. So after that, they'll announce the dates. Okay? Thank you very much. Okay. So we are done with the long case details. Please tell me any question from the long case. I'll go to the circuit now. Circuit is a circuit. Okay? When we talk about the circuit, it is like a circuit and it has stations. Multiple circuits are going on. 10 minutes each. Okay. You have one rest station for 10 minutes. Breathe in, breathe out, just relax, and rest are going to be active stations. Out of these circuit, you have 10 minutes each. Omar, are you there? Omar, I'm taking the baby steps for you. Listen to me carefully, my boy. All the boys, please don't get overwhelmed by the girls, yes? Okay, thank you, Umar. So, this is the rest station. Please remember, in each station, thank you very much. Love you more, Rosina. With each station, you have 10 minutes and one rest station. Out of these, only one, not necessarily number one, anyone would be patient, role player, rest all would be with the examiner. Anyone can be a simulated patient task, okay? Either this one or maybe fourth or third or sixth or fifth, but one only. And this is big difference from our COG, where back to back you've got patients, back to back you've got patients. Okay, clear? So one is a patient talk. Here, 10 minutes you're going to talk to the patient on. Only patient. And rest are the exam. Could I make myself clear? Now, we have a further distribution in the circuit. In the last 2 months, when exam is near, you get your acceptance. I tell students to make your outlines. For example, you do maternal medicine, right? You're one station. You do surgical procedures, around 10 surgical procedures I've given in the folder on the website. Your one station is done. You do labor ward or obstetric emergencies, one station is done. You do general gynec, like vaginal discharge, HMB and all, your one station is done. You do simulations, like shoulder dystocia, ECV, breech, vaginal delivery, drills like operative vaginal delivery, forceps vacuum, your one station is done. You do PBNs, angry patients, one SPT is done. Do you guys get it? So from gynec, generally we are getting in general gynec plus specific gynec, like urogyne, fertility, early pregnancy, one station. So we have got 2 stations from gynae, right? Generally, we have got 1 station from maternal medicine, some disease, 1 station from the labor ward we are getting, 1 surgical procedure we are getting, 1 simulated patient task we are getting, 1 hands-on mannequin, instrumental birth or simulation on the mannequin we are getting. We are done with 7 stations. This is how I teach them that please do not spend so much time on everything. Be smart. You do your 10 surgical procedures, your 1 station is done. You know how to talk, how to do the breaking bad news, your 1 station is done. Are you guys with me? This is the difference between a smart student. I want that today you guys make a perfect start. There should not be any confusion that what is the exam all about. It's a very straightforward exam. That's why students do it in 20 days. You know? So you should know your sections. What are you being asked for? And if you do my regular and my fast track stations, not even a single station would be out of this. They are the maximum that can be asked in them. I always give 15, maximum around 22 to 30 long cases. Out of them, you'll get a long case, 100%, and 75 to 100 circuit stations. That's your total curriculum. Isn't it easy? Isn't it doable? Why should we be nervous on this? That's something we all can do. Do you guys get that? Yes, this is what you guys would see if you go to the daily schedule. Everything which is given there is a recall. And if you prepare those stations, nothing should be a trouble. How to pass MRCPI OSCE in one go? Understand what exam is. It's not a haphazard preparation. It's not a random preparation. Just know your sections and learn your sections. College will give you an email that this is coming up. And these are the number of the stations. And you don't have to search anywhere at all. You have to know about what is expected. And I want you to come up to the expectations of your mentor, because you would see that your exam would be easy if you will have a tough preparation in the course. Right? For the circuit presentation, students were asking about how to do the time management. Please see that we have a structured discussion. You do a good intro, whatever intro you're comfortable with, but a good greeting. You've got a simulated patient task, and in the simulated patient task, things are different because you're talking to the patient. In structured discussion, you introduce yourself. I'm Dr. Farhana, I'm one of exam candidates, or how you want to greet. If it's a morning time, good morning, or you want to say good afternoon if it's an afternoon time, but do a very good greeting. Once you do a good greeting, you introduce yourself well, you get a question, but you don't have questions in front of you. This is the table, you are sitting here, your examiner is sitting here. You've got a scenario on paper here, you've got an A4 sheet here as well. Every table has got an A4 sheet and every table has got a pencil or a pen. All right, so you can write down accordingly. With this, you should be knowing that once you are reading the scenario, you tell them that yes, I'm ready for the discussion or I'm ready for the questions. The examiner starts asking the question one by one, answer the questions. Simple. One by one, start answering the questions. And they'll ask the next question. They'll ask the next question. In structured discussion, please explain in medical language. Give the sources. What sources you have. You've got a green top guideline. You've got a nice guideline. Okay. And with this, tell your references. If you have medications, speak proper pharma names. Okay. So this is examiner discussion. For example, 100% they're going to give 2024 guidelines Irish. I am so sure that all circuits are now made from the recent 2 years. And if you go to your website, you've got a separate folder for them. Okay. When you see that it's an SPT, then examiner generally doesn't prompt in between. It's a layman language. Generally, it is talking to the role player. Hello, I'm Dr. Diba. I'm one of the exam candidates. I'm going to read my instructions. You go inside. Here is your table. Here is your examiner. You are sitting here, and here is your role play. So here are your instructions, but you both are talking to each other. Okay. With this, when you guys are talking amongst each other, the examiner is just observing and noting the points. That's it. Nothing else. For this, you have to be very clear that you do not speak jargons and you be very sensitive and empathetic. Remember, there's only one case where your communication is being sussed. Are you guys following? All right, there's only one case where your communication is being sussed, and that's so important that you be good at that. All right, so ensure that you guys know the topics again, around 25 to 30 SPTs, and you get from them on. Very, very easy simulated patient tasks are there. You guys would start loving it when you start doing the communication with me. Okay? For the long case, as I've already told you the tips, that please divide the long case into sections. Be perfect in history, be perfect in examination. Start working on it separately, step by step. For example, it's okay if you don't know the topics of the long case. Omar, Farheen, Rosina, Iman, Manahil, Humaira, start doing the examination. Make your examination perfect, obstetric and gynae. You've got the folders on your website. You've got the folders in your group. So if your examination gets perfect, you're done with one section of the long case. Do you guys understand? See? Make your examination perfect and start doing it daily. I used to do that. Just catch your mom, catch your sister, catch your daughter. And believe me, students, they say that whole family members start doing. Put a pillow, start doing some physiofundal height, take an HSA. This is how we learn. Students, they say that, ma'am, I have got such a long 12 hours labor speed rotation. My Irish student, right? You know what did I say? Please call me once you reach. And when he called me from the labor suite, I did a video call and I said that, who's the midwife now? And there was a midwife outside. And the patient was 3 centimeters. I said, just take these 10 minutes. This is your midwife and this is the case. Please present with her and send me the recording. I mean to say, why you guys want excuses? On your duty, just catch your nurse and do a station, do an SPT. Send the recording to the moderator. Why do we need excuses in life? Single. I still remember when I used to have a list between, Operation Theatre, in between my Amanda Jones, my Seema Sharma, so many books I used to do in the theater because they were like, cover to cover, sitting in between the patients. It's okay. This is how the life is. You should learn how to utilize your time. And ask me, I'll tell you what you guys have to do. In your clinics, you get 15 minutes, 10 minutes. Do a structured discussion, do an SPT, do the labor examinations there, take the obstetric examination, send a video that, ma'am, this is my examination, can you correct me? You have to catch your ma'am. Don't make me free. Don't make me lazy. Make your mentor very busy. Please do utilize your time. Do you guys understand? I will tell you the ways, but come up with the problems that here we cannot do, because for problem, there's a solution. It's how you learn. So Kishwar, I know your most of the nights are in hospital only. But still, I do not agree with that in hospital we can't do. OSCE is very easy in hospital, my love. Got it? Do you guys get it? Long case, don't do 25 minutes in a go. Start working on sections. Start working on different sections. Make it your strength, and then we'll compile it together. Understood? Yes? When you send your recordings and the moderator gives the feedback, please listen to the feedback for others so you don't have a problem. Okay? I was thinking that 1 hour we'll do an introduction and 1 hour we'll do the discussion, 30 minutes for one case. But we've already taken. Now, what do you guys want? Do you want to do one sample simulated patient task today? Or we can do that in the session, the first session. Okay, Kishwar was asking. Kishwar, the moderator will give you all the topics, possible topics which I'm discussing. So you guys would prepare session-wise. So for the next session, she'll give you the topics today. Okay, which you have to prepare. Because I want full preparation in the session. All the active participants, schedule of the presentation would be given by the moderator, and you guys would present according to your turn. Okay, the ones who are listener, they would be listening to them, and they can definitely ask questions if any. Okay, all right. Please let me know. Do you want to do one station today, or shall we do in the session? What do you guys want? Okay, the ones who are asking for the link again, we have 2 links. Okay, few of the listeners were asking that, ma'am, we want to convert to the active participant. Please So you've got an active participant link. You can book onto that. The ones who had booked for listener, they can just play the difference and they can just pay the difference and they can convert that on the active participant. Okay. Few of the students yesterday messaged that I think it was Aya. Yeah. So the ones who are listener, they can just pay the difference and they can be actives. No worries at all. The fee structure is in front of you guys. Do not forget to do the advanced registration for the mock exams, please, so that we can make just the pattern. And if at all you guys do not get the seat, your mock would be free for the next attempt. Like in Riyadh, the students who did not get, they are in the UAE mock now. All right. Okay. The fast track link I'm just going to send you now, Diba. Active or listener, Diba? Active or listener, Diba? Active?
Yes, active.
Active, my dear, will send you now. No worries. And start preparing in time with those recent, yeah? So, fast track MRCPI OSCE active link, please. Okay. I'm sending you in the group, people. Okay. I'll just share with you. All right. Okay. So please let me know that now any questions regarding the intro is there. I'm happy to take. If you guys want one station, I can do one station with you guys as well today to kickstart whatever you guys want. I'm happy to do that. And for the first session, when are we having the first session? When are we having the first session?
15 June.
Wait, let me have the schedule here. Okay. Oh, perfect. We are having on 15th of June. All right. So this is a circuit or a long case? It's a circuit. All right. So that means that I'm going to do the circuit stations. You'll get stations from Binta Hava. Please tell her to put the stations, and then we will have the structured discussions and the simulated patient task presentations. And with that, we will have the feedback. Okay. And then alternate, we'll do one long case, one circuit, one long case, one circuit, so that you have a grip of both of them. I'm happy to take the questions, if any, please. Deepa, I got it. I'm sharing in the group, okay? November, I've sent Betty. Okay, great. Thank you very much. Thank you. Yes, can I book fast track after seat confirmation is active? Sabah Fayaz, just reserve your seat at least because actives are going to be 8 only, not more than that. Yeah. So that's the only reason. Like, for example, Deepa is booking now. I think 2 already I have because they were shifted from the previous. Yeah, one thing, Sabah. If you don't get a seat, freeze the fast track. Okay? Sabah, freeze the fast track. Don't use it. Got it? Sabah, you understand? So if you're using, use it in the next attempt. Don't use the fast. Everyone, please. The ones who do not get the seat confirmation for exam, please don't utilize your fast track. Fast track is very fast. It should be done before exam only. Do you guys understand? The premium is okay. It makes your basis. But fast track is the final polishing that should be before your exam. Sabah, I've shared that in the WhatsApp. See the WhatsApp? Deepa. Sabah, I'm tagging you, please see. Sabah Fayaz, Sabah Khalid. I've shared my dear. Yeah, this. And then, because it will start after the confirmation of the seat, so freeze it and use it in the next attempt, February fast track, use it. Okay? It's not that it's going wasted. All right? Okay, perfect. All right. Somebody was asking some question, I think in the chat box. 15th is, wait, guys. You're right. 15th is Arafat and 16th is Eid. So what do you guys want? Should I postpone? Yes, 15th is Arafat. So otherwise it should be after fasting. What time do you guys want? 2 p.m. GMT is okay? What do you guys want, please? Tell me if we can change the 15th one. Okay, we can discuss in the study group. Okay? We can discuss in the study group. Before? Fajr Qureshi, I'll share here as well. Fajr. Active participant what? Fast track or regular? Fajr? Active participant premium course? I am happy if you want after Eid, no problem at all. Regular Fajr. Where to send you here? Where to send you, my dear? Can you please WhatsApp me? This is my WhatsApp. This is my WhatsApp. The first one. Okay. So you can send me a WhatsApp. I'll send you the link here also. This is the WhatsApp. Okay. And this is the fast track link. Active participant, right? So let's do it, Hoyam, if you guys are happy. Yeah, sure. Fajr, I've sent you the active participant fast track link. You can just go to the link from here. All right. Riri, if you have booked, definitely will add you active. Riri, if you book, I will definitely add you. Saira, on the booking of the exam, I always start on the confirmation seat. I start the fast track. I don't start it before because fast track is only for those who are appearing in exam. Okay? Okay, Saira? But booking, if you don't get the seat and you're an active participant, even a listener, just freeze it and use it in the next attempt. Many students in Riyadh, they had on freeze. Remaining cases of MRCPI should be discussed in our group discussion. Absolutely. All right. So you've got your daily schedule. Whatever is in the schedule are complete recalls. All complete recalls they are. Nothing else is needed. These are all the exam stations that had been there, the long cases that had been there. You just have to go through this PDF, which you have it in your premium course, and nothing is needed other than that. This is your complete curriculum. Complete curriculum.
Mom, excuse me.
Carol? Yes, my dear Carol? Active participants are the ones who are going to present. Listeners will listen to them in the session. There are two courses, Premium and the Fast Track. The Premium is this, which you guys are going to start on next week. And the Fast Track is going to be complete one paper, one day, 6 papers we are going to do. Starting from the last one, from 2 days of May 2024, then 2 days of February, 2 days of November 23. Got it? So in one day, we complete one day of exam. Carol, Claire, and in Premium, we do circuits from the previous exams and the long cases from the previous exams, but one by one. Got it? Yes, Shalila, people are booking. Yes, people are booking fast track. Absolutely. I'll share the fast track links in the group as well so that you people have it in the Telegram, please. So no confusion at all. All right. Okay, active and listener, both I'm putting in. Diba, I've received your registration for the active, my dear. Fast track. Yes, I received it, my dear. A team will just add you in the group, okay? But Diba, if you don't get seat, please freeze it, don't use it, okay? Fast track, just do it before the next attempt. I mean, whenever you get the seat. Hopefully you will get, inshallah, but still. Okay? Okay, my love. Thank you very much. All right. Any question, please? Okay, let's do one station, guys. Do you want to do one station? Or do you want me to start next week? I'm happy both ways. If you guys want to be friends, it's too
Mom,
much
please.
to take. Well, yes, Tura.
Just one query regarding this daily schedule. As we started, we start with ebook or with guideline, and I saw that in portal the same topic. It's presented in different place. So,
Tura,
can
I'll tell you
advise
one.
me?
See, there are certain stations which are topics which are so important. For example, sickle cell disease. 2020, we had it as a circuit station with an examiner discussion. Okay. Now, before that, it came as an SPT, as a sickle cell disease preconception counseling. All right. It was one long case. So there are certain topics which can be as an examiner discussion, as a simulated patient task in the circuit, and as a long case as well. There are certain topics like that. So we should have a full grip. We should know if it's an ST, what should be our attire. If it's an SPT, what should be our attire. If it's a long case, what should be our attire. We do the job. Okay. Similarly, breach, somebody was asking, right? Saira Liakar, you asked about breach. Saira, breach is a structured discussion as per breach simulation is given and you have to perform love sets and Marshall's Millimeter. It's a breech hands-on. As I told you, one simulation comes on the mannequin, right? Sarah, are you there? Okay. Then, similarly, breech presentation is a long case. She comes at 35 weeks for a plan of birth because she has a breech presentation. Understood? So it is a long case as well. Along with that, breech can be a simulated patient task, though it's not there, but it can be a simulated patient task. For example, anencephaly is a recall, breaking bad news. It was a neural tube defect with a breech. So somewhere there are certain topics which can come either ways, which are college favorite. SUI, stress urinary incontinence, is a structured discussion. You have to know about all the guidelines. Stress urinary incontinence had been a long case just recently. I'm going to do that in the recent exam fast track. And then stress urinary incontinence has been a simulated patient task, the patient coming with cough and leak. So there are certain topics which can come in three different ways. But there are certain which cannot come as, like PPH cannot come as a long case. It would definitely come as an obstetric emergency in a circuit. It can't be an SPT because it's an emergency. Do you guys get it?
Yeah,
Yes.
so should look for that in the ebook and then looking for other place if it's present.
Yes.
And
you
start
can
with guideline or go
like
with
how
ebook
this
direct.
case come. Yeah, no, Thuda. You can write in the group how this case can come. Moderators will tell you immediately. Yes.
Yes, great. Yes,
Yeah.
thank you.
Excuse me, ma'am.
Yes, my love.
I just wanted to ask that as the when the long case or circuit anything will be discussed, what will be the your way because I had once attended that me long case because I didn't get the seat, so I was just looking at that. The topics and everything were not told before the session. Obviously, we do read everything, but we are not aware that
Session are
what
you
is going to
talking
be
about, my
discussed.
love?
The long case, mainly the long case, which will be discussed. Like if two long cases are discussed on one day, like you are going to do the session. I just wanted to ask that in initial sessions, would it be possible that you are going to tell in advance to the whoever is the presenter that are you assign someone that you are going to present this case? Because then we will get a more idea because after doing some preparation and drill, then we are aware that yes, this and this is the way. But sometimes we get blank that now we have to just present, and that is not beneficial for many candidates because we are listening. And if somebody is not saying anything, I know you do brief at the last that this was the way, this should be the way the case should be discussed. But if beforehand something picture can be seen that is not visualized in that case, if that case has to be presented like a surprise, like you have to just present, you are just saying me that Anila, go and present this case, this is your patient and start now. So if in initial session, like one session or one session would be more than enough, where you will assign the candidate beforehand so that though they have a total grip of that topic. And because even though we are prepared 100%, it's not like we are going to present the way it should be. Sometimes we know everything, that is also very difficult to present because the main thing is the presentation skill.
All right. I have one request, please. If you stop knowing the topic in the entire session, you'll learn only that topic. What is the benefit?
Just one session, so that.
But why, Anila? Why are you fearful of making mistakes, Veera? If you make a mistake, it's absolutely.
No, I just wanted to, because the previous sessions when I was hearing as a listener person, so I was hearing those cases, and some of the candidates, one or two candidates were total blank. I know that is for them. They learned that how I get speechless.
We all get blank in the start. We all have the difficulties in the start, but it's just like we should understand from this. Anyhow, if you all would agree with, if any individual, I won't make it a routine because I have to be strict as a mentor. But if you individually as an active participant, or if anybody else as an active participant would like to know one topic only, I can be flexible for like one session, but not as a routine.
Okay, that's my request. Yes.
Thank you. Yes, please. Hayam, you were saying something.
No, nothing. Maybe by fault
Yeah.
only.
No problem. No problem. Okay. Anything else you people want to say, you want to do, you want to speak? Please let me know.
No, I
Yes.
want to only if there is any topic today for ectopic pregnancy,
So
long
if you more people want, I'm happy to take that. It's prepared. Should we do that?
Yeah, please. If you can.
Okay. Who's gonna be the participant?
Me, if I
Come on,
can.
guys. You can do?
Yeah.
Okay. Unmute yourself and become visible. Enter into the cubicle, please.
Okay. Hello, I am Dr. Huyam, one of the doctors in the emergency clinic today. Can I know your name and age, please? You should start or no, or what? I don't know.
Doctor, I'm Alina Gomes. I'm 31 years.
Okay, Alina, how do you want me to address you?
Call me Alina.
Okay, Alina. Alina, I know from your notes that you are Dr. Sidra, sorry, I didn't read the instruction first. Can I start from the beginning because the screen is not showing me? I didn't find the screen. I don't know where it gone. Yeah. Just now I find it. Can I start from the beginning?
Sure.
Okay. Okay, doctor.
Your time has started 10 minutes. It's only 8 minutes remaining.
Okay, doctor. I am Dr. Huyam, one of the doctors in the early pregnancy unit today. Can I know your name and age, please?
Hello, I'm Alina Gomes. I'm 31 years, doctor. I'm having severe pain in the tummy. I'm not well.
I'm so sorry to hear about that. Do you want me to give you any medicine for pain?
It's okay. They just gave me the medicine now, and the injections are going. Please, can you tell me what's going on?
Okay, I will ask your my nurse to give you a medicine, but let me confirm if you have any allergy from any drug.
No, I don't have any allergy. No.
Okay. How are you now feeling?
It's okay. Please go ahead, doctor. What's going on? I'm really concerned. I hope my baby's okay. I'm pregnant.
Okay, Alina, I get from your GP notes that you are pregnant in 6 weeks and you have pain in your lower tummy. Is that right?
That's what I'm here for.
Yes, please. I want to ask you a few questions so that I will know more about you and your condition. Is that okay?
Okay.
Alina, can you tell me more about your pain, how it is strong and how it is started?
It just started in the morning. I had a discomfort. Oh, but now the pain is very severe on the right side. Initially, it's my third pregnancy. I had the first miscarriage, and then I had an ectopic on the left side. And now this time I was expecting that everything's gonna be fine. We just did an ultrasound. I hope my baby's okay. I just want a healthy baby.
Okay, I'm so sorry to hear about that. But I want to reassure you that we are here to be with you and to help you. Is that okay?
Thank you, doctor.
Can you tell me when is the last menstrual period?
I'm 6 weeks today.
And your menstruation was regular?
Yeah.
And if you have any bleeding or any discharge from down below?
No.
Okay. Can you tell me if you have nausea or vomiting or any shoulder tip pain?
I have sickness, but no shoulder tip pain.
Okay. Can you tell me if you have any fainting or dizziness? Okay. Alina, can you tell me more about if you have any other medical condition? You are seeing your
No,
GP.
no,
You have any?
doctor.
Okay. You have any surgeries or in your tummy or down below? Okay. Can you tell me about hello?
Mm-hmm.
Yes, please. Can you tell me if you are have any history of sexually shared infection, you or your husband? Pardon me asking.
I'm sorry, I don't know. I had a vaginal discharge, but I'm not really sure if it was a sexually shared infection. I never got checked for that.
Okay, good. Can you tell me if you are smoking or you have any recreational drugs? Pardon me asking.
No.
Okay. Alina, what do you do for a living?
I'm working as teacher.
Okay. And how is support at home? Okay. Alina, I want to thank you for sharing all this information with me. And do you want to add anything?
No. No.
Okay. Alina, can you tell me about your blood group, if you are aware of?
If it's a little bit negative,
Okay. And how is your body height to weight ratio?
22.
Okay. Alina, can you tell me? I want to examine you in the presence of a chaperone. I want to check your vitals. I will let my nurse to check your vital signs, blood pressure and pulse, and I will examine your tummy and from down below if necessary. Is that okay?
Yes, doctor.
Okay. Can you tell me from your notes and examination, from history and examination, and from your notes, I find that you have something called ectopic pregnancy. But I see you now, you are coming alone. Do you want someone to be with you?
What happened, doctor? I'm so concerned. Is everything all right? I'm getting anxious. My heart's beating so fast. I feel dizzy.
I'm so sorry for that, but all this question is important to decide for your management. Is this okay to proceed for your consultation?
Yes.
Okay. You have this condition called ectopic pregnancy. This means that your pregnancy is outside your womb, and I feel that you know about this one because you have before like this condition. Is this right?
Yeah.
So
Why
now
again?
I'm so sorry for you to go through
Why
this. I know it's very
ectopic?
difficult for you.
Why again and again ectopic pregnancy in me? I just had an ectopic and they gave me injections. Why
I'm so
again ectopic? Why me? Why I can't little baby.
I'm so sorry for that. I am so sorry for that, Alina, but this is happening. Sometimes the patient, if he has ectopic pregnancy, is the first time, there is 10% chance that this will happen again. And
having an ectopic and then having healthy children, that means in my life I'm going to get all ectopics again and again. I can never have healthy pregnancy.
Yes, I can understand your concern, but we are here all to help you and support you. Do you want a cup of water, please?
No.
Okay. Take your time to relax. Is it okay to
Doctor,
continue the presentation?
What have we done now, doctor?
Now we have 3 options for the management of this case. The first option is expectant management. This means that we will let the nature to take its go, but this is not suitable for you because you have severe pain. Okay? Is that, are you with me?
Yes, I am.
The second option is we will give you medicine in your intramuscular injection. This is methotrexate, and this one will be followed by the pregnancy hormone. But before that, we should do for you blood investigations, and this blood investigation will include the beta HCG, the liver function test, the renal function test, and we will do for you also the blood group and electrolyte. But this one also is not suitable for you because you have also pain and your pregnancy hormone is so high, so it is not suitable for you. Is this right? Is this okay for you, Alina?
What is fine for me? What do you want to do? Please, can you
We
say
have
me?
Okay, we have the third option, which is surgery. We have 2 options. Either we will do for you pinhole surgery or operation in your tummy. And the operation, inside the operation, we can see what is suitable for you. If we can remove the tube, which contains the pregnancy, or according to the situation of the other tube. Do you want me?
Doctor, is it the same ectopic pregnancy which I had last time?
Yeah, it is. But in the right side. The last time it was in the left side, and now it is in the right side.
Now you have to move to the next cubicle. Now in exam, you have to move to the next cubicle. All right, so the circuit ends. This is how the circuit exam would be. 10 minutes for one, and the bell rings, and then you move to the next. Please pay attention here. You do not have a separate reading time as an MRCOG 2 minutes.
No.
In MRCPI, we do not have reading time separately. You enter into the cubicle, your 10 minutes start, and that is whatever you're utilizing for reading is you're utilizing your 10 minutes time.
But I thought this is long case. That is why.
How long case when we are doing a simulated patient task?
This is what I am telling you in the first when you ask about this. I said to you we have too much confusion between the long case simulated patient task and this one and this one. This is what we have.
Circuit, right? No. And in emergency, let me tell you guys, you've got an obstetric, you've got a gynae long case. Early pregnancy generally doesn't come because it's a part of a gynae and it doesn't have an obstetric examination because it's an early pregnancy. So topics or the early pregnancy cases would generally be in the circuit only.
So the simulated patient task, is similar to what is happening in MRCOG.
Same, only one station. I told you, right? 7 circuit. Out of that, 1 would be SPT. This is that 1 SPT.
Yeah. Now clear.
Okay, got it. One thing which I was facing here was that you were taking too much time to read. 10 minutes the bell started and 8 minutes we started the station, which is too much. I want only 9 minutes 30 you should start the station. 30 seconds for reading. It's not more than.
Oh my God.
Because you don't have more time. Everyone, can I have the cameras here? Quick, let's discuss, please. Hoya, you were beautiful because I know you have had MRCOG sessions with me. I know that you know how to speak. You were amazing in support. I want all the cameras and the round of applause for Hayam for two perfect reasons. Hi Fajr, how are you? Good to see you. I want all the cameras for applause. Usi? No, not in the chat box, Usi. Yes, live. There are two reasons for that. The way she has acknowledged, the way she has done reassuring, the way she has done the support, that was heart winning. Clap, 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 everybody, and lots of applauses for this support which she. We did make mistakes. We did make mistakes, but support was very good. I'm sorry, the lines like, examiner loves it. I've given her stars on. I'm sorry that you're passing through a difficult time. Beautiful line for passing communication. We as a team of doctors are here to support you. Another beautiful line that examiner loves. Okay? Then she was so good in terms of I'm sorry for this, acknowledging, echoing. This part was very good in Haya. Okay. So she did an introduction. She ruled out allergy for the painkiller. That was very nice. She said, sorry to hear about this. Amazing. She beautifully asked about shoulder tip pain. That was wonderful. Why? Because she was ruling out ruptured ectopic versus an intact ectopic. Agreed? Yes, that was very, very good. Then she asked about the vaginal discharge. She ruled out pelvic inflammatory disease. That was again very, very nice. She did a breaking bad news. I can see that you're here alone today. Warning shots. Would you like somebody to be with you? I'm afraid that I have a difficult case to discuss with you today. Very nice. She beautifully gave expectant medical and surgical. So that again was amazing in terms of sequence. Okay. And then she was so clear in the applied clinical knowledge that with this beta HCG and with pain, she cannot have expectant and medical. It has to be a surgical. So beautifully, she told about self-injotomy versus self-injectomy, seeing the tube, seeing the surgical state, and then we are going to decide what suits you best. We will try to save the tube. If not possible, we're going to remove the tube to avoid the complications further. These parts were very, very good. But, Omar, I'll just take the question. Do not waste time in reading too much. I will give you, and you have to be speedy, 30 seconds on. Okay? 30 seconds on. I said that I do not know I have sexually shared infection or no. You said, okay, good. You can say, okay, okay, good was not the right statement at that point. Okay? I will say, okay, good. So I have written that it was a little communication flaw. Okay? Then this patient was a negative. The biggest patient safety we had to
if we should give you NTDs.
This is the most important patient safety. Examiner would have it highlighted in the examiner key. Please, nobody should miss NTDs in exam because it's a highlighted point in the examiner key. Okay? You check the BMI, it was fine later. Jehovah's Witness was missing. A bleeding patient always asks about the reservations of the blood transfusion. It contains coal. Okay? Do not miss that out. And then, would you like to have tissue paper or water? I would rephrase that. I would say, please have this glass of water. Please have these wipes. Do you understand? Why? Examiner is waiting to score you on this. I was weeping so much. Please give me water. Then you realize after 2-3 minutes, oh, I forgot it. And then you said, can you have this tissue? Can you have these wipes? Do not say, would you like to have? Just ask them, okay, please have these tissues. Take your time. As soon as you're better, let me know. Okay. These were the points which we could have improved. Now, question from you. I've given you a detailed sections of long case. How could you think that it is a long case? A long case would be history. Examiner would do a prompt. We'll tell you, please examine the case. After history, you won't come to the explanation. He will give a prompt. She will give a prompt. They will take you for the examination. Then they will ask you that will be an interaction. Do you understand? Right? If you don't have to mix the SPT with the long case at all. Long case section and attack. Otherwise, you can't mix up, Hoyam. Why? One thing is in the morning, one thing is in the afternoon. The circuit is back to back. You have your cubicles. Long case, you know that you're going for a long case. You understand an exam.
Yeah.
All the candidates will have the long case. There's no confusion. SPT is in the second part, or if SPT circuit is in the morning, long case is in the second part. Do you get what I mean? So in exam, there's no confusion that you would do SPT as a long case because you know your circuit is going on back to back 10 minutes, 10 minutes, 10 minutes. Got it? Enough. So in
This is
exam, there should not be.
I got my heartbeat is increasing when I know that it is 10 minutes only. I prepare myself for long case so that I forget most of the questions I want to ask the patient.
No, and one more thing, please. I have given you guys around 20, 22, 11, 11 most. And in the end, what I do in the mock exam, I give around 7 and 10. I give my guess. So this time, my 3 top guesses for the obstetric first came as obstetric, and my third guess of gynec came as an exam because, I review the past cases and then, it gives you an idea that this is a possibility. So long cases, early pregnancy is almost nil chance that you'll get in a long case because you don't have any finding in terms of obstetrics. In pregnancy, they give you third trimester onwards. Always. They never give you 8 weeks of pregnancy in a long case. Do you guys get it? Then we need to have some obstetric examinations of Leopold, guys. Understood how I am? They won't give you early pregnancy.
Okay.
Okay, and they will give you an obstetrics, a gravid uterus sort of a finding. Make sense?
Yes.
Okay, Omar, you want to say something, please?
Yes, please, ma'am. First of all, thank you for this good presentation about the short case. I'd like just to know about, I got this feeling, and please correct for me, when I read at the bottom of the short case about the conclusion is the right side ectopic pregnancy, I got that feeling there is no need to waste my time about some past-like examination or something like that because I already got the diagnosis here. Also about the management, Dr. Hayam told us about the expectant management, about medical management. Can I skip these parts and or give a brief speech about them and jump immediately to the laparoscopic treatment?
So what I would do is that in this situation, Umar, your first part is quite valid that when the diagnosis is done, we should not be wasting time because it's not, see, there are 2 different cases, everyone. One case can come in exam that the patient has presented with pain abdomen and you've got lots of DDs in your head, okay? And the other is that she's diagnosed. So your things are easy when it's diagnosed. I mean, you are filtered in your questions. Omar is right in this. Second thing, Omar, please remember, in MRCOG3, in MRCPI, or in European board, we never go directly and say, you have only this one option. Exam is always about giving options and giving the pros and cons. But the option which suits her best, you should definitely say that it's the suggested one. Okay, so she was right in telling about that we've got 3 options. Out of them, because you're having pain and the pregnancy hormone is higher, therefore we suggest the performing the surgery for your case. However, we do have other options like we leave the nature to take its course, or we have the medicine as well. But it does not suit you in this case. You have been through that, so you know how medicines work. But patient has to be pain-free for that. And the pregnancy hormone should be lesser than the value which we have today. So this makes sense. Okay, but stress upon this the surgical method. Okay. Thank you very much. Any other question? I would like to do this station for you guys so that you understand the empathy, please.
The
Okay?
patient is in pain. Okay,
Yes.
patient, she's in pain and the patient is crying and she's not comfortable. So we cannot offer her to be, she will be on the bed and she will be relaxed.
Yeah, I'll do that. I'll do that. Okay, no worries. I'll just do that to tell you. Okay, anybody can be my role player. Let's have a presentation quickly. Anybody can be Hoya?
Yes.
Let's change the roles. Anybody wants to be my role player?
Yes, I will be.
Hoya?
Let me give another chance for another one. Maybe he will
Okay,
know.
who wants to be the role player? Anybody wants to be the role player?
Yes, ma'am, I am the one. Okay.
Yes, ma'am.
Saba?
Yes.
Okay, and Rosina, I can't see you.
Yeah, okay, ma'am, let's Sabah.
Saba? Okay, Saba, settle your
Yes,
camera.
ma'am. Yes.
But do act good, okay?
Yes, ma'am.
Okay. Now the 10 minutes are starting. I'm entering into the cubicle, okay? Hello, I'm Dr. Hayam. I'm one of the exam candidates. I'm ready to read the instructions, please. I'm ready to start the case. So the examiner would tell you that please, your patient is here, okay? Hello, I'm Dr. Hayam. I'm one of the doctors in the early pregnancy assessment unit today. Am I talking to Elena Gomes, 31 years?
Yes, doctor. I'm Elena.
Is it okay I call you Elena?
Yes, doctor. It's fine.
All right, Elena, I can see that you're here today. I'm sorry that you're passing through a difficult time and you're in pain. Do you need any painkiller at the moment, or it has been provided to you so far?
Yes, doctor. I just got one. I don't need at the moment, but I'm really worried. What's going on?
I'm sorry, I can see that it's a difficult time. We, as a team of doctors, are here to support. So, Miss Elena, if you're okay and comfortable to talk to me at the moment, few quick questions to evaluate the condition. I've got your reports and I'm here to discuss about them. Is that okay for you?
Sure, doctor, but please explain me as soon as possible that what is it and how it can be managed, please.
Absolutely. I'll be very quick. I can understand how important it is for you. So just wanted to know that what exactly happened and what made you come to the early pregnancy assessment unit today.
Doctor, I'm pregnant. I did my pregnancy test few days back and I had too much pain. And so that's why I came here to visit to check the reason that why so much pain in my normal pregnancy.
All right. So this is your third pregnancy, correct?
Yes.
So in this pregnancy, it's around 6 weeks duration. That's what the case notes they tell me about, yes?
Yes, doctor, almost.
Any sort of a complaints in terms of bleeding along with that?
No, just the pain.
Any shoulder to pain?
No, doctor.
Do you feel dizzy or do you feel that you have any sort of awareness of the heartbeat?
No, doctor.
Okay. I'm sorry to take you back to the previous pregnancies. I've gathered that you had one miscarriage and an ectopic, and it was dealt with the medication. Anything you would like to add on in terms of recovery? How was that?
Doctor, it was a stress, of course, not to have the baby after both these pregnancies. Otherwise, recovery and everything was fine. There was nothing to tell.
Extremely sorry to hear about the past experiences. So, do you have any sort of a problem in terms of vaginal discharge, running fever?
No, doctor.
I'm sorry, personal questions, but they would help me to evaluate the condition. Any sexually shared infection in the past?
No, doctor, nothing like this.
I'm sorry, again, it's a sensitive question, but do you have multiple partners, multiple sexual partners?
No, doctor.
Okay, all right. Okay, so with regards to your medical condition, any medical problem you're having?
No, doctor, I'm fit and fine. Only these things going on with me.
Any family history of concern?
No.
Personal habit questions. Are you smoking or drinking alcohol?
Occasional smoking, but not in the pregnancy, of
Mhm.
course.
Okay, all right. Are you allergic to any of the medication?
No, doctor.
Okay. Did you have the blood transfusion last time in your ectopic?
No, doctor. They just gave me few injections. They explained me everything. I gave them the permission and no transfusion, nothing.
Case needed, are you okay with the blood transfusions or do you have any reservations?
No, doctor. I don't have any reservations. If it is essential, of course, we can do.
Right. I would just like to double check. We've been provided with your blood group. It's A negative.
Yes.
Were you given certain injections in the previous two pregnancies management?
Yes. After the injections in last pregnancy, I got them.
Okay, we'll get back to it after we formulate the management plan for you. All right. So thank you very much for all this information, Elena. Anything you would like to add on?
Nothing special, doctor, except that I'm really worried regarding all this, what's going on,
Can
and
I
what
double check?
to do for it further.
Can I double check your BMI?
Yeah, it's normal before the pregnancy.
Okay, all right. I can see that you're here alone today. Would you like somebody to be with you?
No, doctor, you can tell me whatever you want to explain, but please help me out.
Yeah. I'm afraid that I have a difficult news to discuss with you today. I wish I had a better news today, Alina. I've confirmed your name on your hospital registration number on your reports, and they revealed that unfortunately again there is no pregnancy inside the womb, and it's
Really,
again
doctor, I'm so much worried already that what's going on. I don't have baby. This is my third time. What will we do now?
I wish that I had some better news for you. Please take this glass of water.
Okay, doctor, but please tell me how to come out of it.
I can see that how difficult it is, but I would like to reassure that we as a team of doctors will be here to give you the treatment options and try our best that whatever is the best possible option that's provided to you, and we take it forward from there. So, if you're okay, I would like to tell you the options available. Is that fine for you?
Okay, doctor, please go ahead.
My consultant would be here to have a chat with you as well. And we have had the pregnancy hormone that's quite elevated. And the ultrasound also reveals that the ectopic pregnancy that is on the right side this time. Because you've had the left ectopic earlier, which was dealt with the medications, we are not very sure about its state. When Elena, the pregnancy hormone is higher, and when the patient has got significant pain, we generally suggest to go with the surgery because there is a chance that the tube might rupture, it might be torrential bleed, and it can be an emergency situation. Are you following me for this?
Yes, doctor, but with surgery, I can lose my tube also. I also want to know about my future pregnancy chances. Will I get a healthy baby? Can it happen again? All these questions are coming in my mind. And of course, if surgery, how will I recover and how will everything go?
All these questions are understandable. And I would just like to tell you that having a tube intact with the previous ectopic pregnancy is a trigger for future recurrence as well. So the surgeon will decide best if the tube condition does allow that the pregnancy can be removed from the tube and it can be stitched back safely without any risk for having future chance. That would be the preferred choice. We call it as salpingotomy. Having said that, after this, we have to do the pregnancy hormone every weekly to check that the pregnancy has been dissolved. If at all the condition does not allow or the tube state is not in favor of being preserved, then the tube would be removed and with the pregnancy tissue so that you can be safe from the future complications. Are you following me for this?
Yes, doctor. And what are the future pregnancy recurrence rates? Can I get a healthy baby after this?
Now, with regards to that, because your other tube, we are going to see in the surgery that how far it is in a condition that it can be a spontaneous pregnancy. If at all the tubes are fine, we would wait forward for having the normal pregnancy. But if not possible, then in that case, we would see that what further options suit you. We've got some assisted techniques as well. You must have heard about the test tube baby, but it's way too early to discuss about this today. As soon as you stabilize, you're out of risk, you recover well, you're going to have a chat about the future options. Is that fine for you?
Yes, doctor, it's really fine. Of course, the current problem is more important. Please go ahead, whatever important for me and whatever needed for me.
Thank you very much for your cooperation. At the moment, we are concerned about the time and we are concerned about quickly handling the situation and doing the management. As soon as the things they go fine and we are having a good recovery, we will have a discussion about all the possible options. Is that fine for you?
Yes, yes, doctor. Thank you so much for all your explanation. Thank you.
We can make the necessary arrangements for shifting you to the theater and the rest of the discussion that will be my consultant will be taking forward. Do you want your partner to be around or do you want us to call any family member, please?
Yes, of course, when all the preparations are there, of course, they will
We'll take
join. They will come also.
we will take the written consent and we'll ring up your husband. He would be here. And I'm sorry once again that we are passing through this condition again. As soon as things get better, we would have a chat about the future prospects. Is that okay?
Yes, sure. After this, I will like to have another meeting or appointment with you, definitely.
Absolutely. I'll give you patient information leaflet. Thank you very much for your time today. Thank you so much. Thank you.
Thank you
Thank
so
you very
much,
much for being a
Mr.
very
Sarma. It was
nice,
really nice.
for a very nice patient. You were so soft and you were so agreed upon. You were not being loud. In exam, she might do a little response to being sad, you know. But she in the station is being tested. Okay? This station is about empathy. So be very, very clear that you are so soft, empathetic, and sensitive in asking questions. Do not lose the score in your communication skills. Be very, very empathetic in choice of words. All right? Thank you very much, Sabah. Did you guys
Thank you.
understand? Thank you, my
Doctor,
dear.
I have some questions.
Yes, please. Yes.
Doctor, I understood thoroughly the history and everything, but you didn't. I don't remember. You did examination or not, and investigations also.
Was
Like
diagnosed. Nothing was needed. All investigations which I needed were done. It is an SPT. Beta HCG was given to me. Everything was given to me. But I said that we will make the necessary arrangements. So that includes the pre-operative things.
like CBC and others.
Yeah, yeah. So you said that we'll make the necessary arrangements. Okay. So
Okay.
here, when you have an SPT, you have your communication being assessed. So go through the station. Had it been not diagnosed, I would have done ultrasound, I would have done beta HCG. That all was given to me. Okay. Why didn't I go to the expectant and the medical? Because she already knows it. She's been through that. So I picked it up. I didn't waste time in asking blood group and all. It was given to me. I took it forward from there. I saved my time.
Okay.
Do you guys understand? And in all stations, when I will do in it, mine would be all cases solved. So you can revise that from the slides, you can revise that from the case scenarios. And yes, when I be the role player, I try to prompt you guys so that I break a template and you guys can answer. That's very important that you guys have a fluency, you guys have a good flow in speaking. Yes, Omar, your hand is raised. I don't know, it's an older one.
Yes,
Or
ma'am,
the
please. Am I allowed to use medical terms during discussion with the patient, or just a common language, or mix between both of them?
if you're using anything, you have to explain that. Like I said, we might remove only the pregnancy. We call it as salpingotomy, like this.
Okay, ma'am.
Okay. If
Ma'am,
patient is not understanding anything, it loses your score. Okay.
Yes, ma'am.
Ma'am, I have a question, ma'am.
Yes, Farhana, please.
Ma'am, we will not tell about the follow-up with beta ECG or UPT.
I told that we'll do weekly pregnancy hormone if salpingotomy is there. If salpingectomy is there, then it's a 3 weeks, 1 pregnancy test. That's it. Yes.
What about the side effects, medical management we do?
So
Side
medical
effects of
management we are not
methotrexate.
doing today, right? Today we are not doing the medical management, right?
Ma'am, in options, we'll not tell.
So I told her that one of the option is which you had last time, but because that is not suitable today because you're having pain, so we suggest surgical treatment.
Okay, ma'am. Thank you.
Thank you very much, Farhana. Thank you very much. Yes, no medical here, Iman. Thank you very much. All right. Now, how fair, guys. Now, for ectopic pregnancy, you've got a recent Irish guideline. That's why I chose this topic, right? Now, similarly, you've got patient information leaflet. For all simulated patient tasks, please do the patient information leaflets. Proper communication, proper words choice. You have PILs on everything. What is ectopic pregnancy? It's written there. How do the ectopic pregnancy presents? What are the symptoms of ectopic pregnancy? What is going to be the ectopic pregnancy management? What is the expectant? What is the medical? What is the surgical management? To get the lines from all the patient information leaflets, and you have it in your channels as well. Okay? Please make sure that you guys know this and you learn this from the PILs. Homera patient information leaflets are the same until and unless the applied clinical knowledge is different. Homera, it's the same, similar ones. Okay. But if any case, for example, NTD would be different, Homera, because NTD, you know, in MRCPI is different, right? So applied clinical knowledge might vary. Okay. Thank you very much. Thank you. I was not expecting the introduction to be so long. I'm sorry I took your mornings, and I am sure that you had lots of commitments, but I'm happy at least that we are what we were having the queries 2.5 hours, 3 hours earlier. Now we are much clearer in our queries and in our flow towards the preparation. Yes, we started up with all this list. I'm going to do a recap again. So what grip is there? What is SP? What is SPT? How to start the portal? Okay, so how to do one topic from all. I think I've covered up all the questions which we had in the beginning, but still if anything is remaining, please, I'm happy to take the questions. Rosina, please. Thank you, Iman. Thank you very much. Yes, Iman. I'm so
Ma'am,
grateful, Sandra. Yes.
ma'am, my question is here we will give the 650, those are the 1500.
625.
625. Okay, ma'am.
Yes.
Thank you, ma'am.
Thank you very much. Thank you. Any other question? Thank you very much. Sabah Fayaz Janani, got your active participation for Fast Track MRCPI. I just got a notification from the website, my love. I'll add you, okay? Thank you, Sabah, my love. All right. Any other question? Any other question, please? Sabah, make sure that you freeze it if you don't get the seat. Inshallah, you'll get it, but still. Thank you very much. I got your registration. Okay. Any other question? Okay, can I see all the cameras? Can I see all the lovely? Yes, Farhana.
Sorry, in the end, ma'am, when the fast track will be started, because I will be traveling in August. I hope it will be starting after
Sabah,
August.
on the day of, no, not August, my love. Exam is in November, right? October, September. Maximum earliest September when you get the confirmation, not before that. In fact, I
Sure,
think
ma'am.
October 1st would be, as soon as you get the confirmation, fast track is ready to start.
Thank
Not
you,
before.
ma'am. Thank you so much. Thank you.
Very nice. Thank you, my love. God bless you. Thank you. All right. Can I have all the cameras here? Ma'am is here for so long. Where are you guys? Fajr, how do you feel, Fajr? Understood something? Some clarification today. Yes, but you were coming and you were going, right?
Actually, I'm on duty, ma'am. That's why I'm coming and going in between.
So you wanted the active participant premium, yes?
Yes, ma'am. But I want to ask, what is the difference between fast track and active participant, the regular course?
Both are active participants, both will present, but premium is circuit, long case, circuit, long case, circuit, long case, different sessions. And these
Okay.
are the recalls, but circuit we do separately, long case separately. Fast track is one paper, 1 day, 6 sessions, one paper, 1 day, one paper, one exam day we do complete with long cases with that. So it's just the presentations are the same, but fast track is a little, I feel that fast track students are a little polished one. I don't teach them basics. I just
Okay.
finally polish them. Here I go to basics, very, very basic steps I go with, in the premium. That's the only difference in terms of course structure. None of the station is matching. Absolutely different stations here and absolutely different stations. Nothing, because most of the students, they're common, so nothing is common in the sessions in terms of
Ma'am,
topics.
my name is Fatma Qureshi. Actually, I don't know how to change the name. This my daughter is the Zoom.
Fatima Qureshi, okay, Fatima, no problem.
Okay, I don't know how to correct it.
WhatsApp, no problem. You can WhatsApp me here, okay? I'll send you the link. Though I sent it, but you can just do that too, okay? This is first one is mine. You know that, right? But
Okay, fine.
this is my WhatsApp, okay? You can do the WhatsApp. Thank you very much. Thank you. Where are others?
Okay.
I want 36 cameras, please, so that we can have one reinforcement. Okay. What did we learn today? Are we the same as we started up? Or are we a little different now? Please tell me. Am I a little successful in making you guys understand what OSCE is? Or are we absolutely the same as we started up? Omar?
No,
Omar,
ma'am,
we said in the beginning, Omar, we said in the beginning, I'm lost, man. Are you the same? Can we see Omar a little shining and little understanding about OSCE?
Yes, ma'am.
Yeah, understood a little? Yeah,
Yes, I open it.
understood? Tanya, did you understand anything? Samra, something clear about OSCE, girl? Yeah? Rosina, what about
Yes,
you?
everything clear. Thank you so
Clear?
much, ma'am.
The things are clear? But still, if any more question comes now, see, don't expect that now you people would be all perfect in presentations. Now you will get a guidance of like what you're doing. Now, when you do a mistake, no worries at all. We'll just settle that. So single day, we'll come up with more queries, but now the level of your queries would be a little not like basics, a little more difficulty level would be better for you guys. Similarly, when we reach to the fast track, we are very, very strong in terms of our basics. So we know what is expected. Anything you guys need, please do not hesitate to contact. I want that from the start you're in the right direction. None of you should lose this type of an exam. At the moment, I always say MRCPI doesn't have this much saturation as other obstetric and gynec. So get your degree, guys, and get it completed. You guys would love all over the world, and you will feel the change in your practices. So many people in Ireland, so many people who were students, and soon you guys would be in the champion list. The only thing which I need from you guys is determination and having confidence in yourself that you all can do it. All right. Okay. If anything is there for me, please let me know. And again, I thought that it would be 1.5 hour session, but I didn't feel that it would go long. Please let me know if anything is there. Thank you so much, Samra. Razan, thank you, my dear. Okay, you people want to change the session after Eid because the days of the preparation are less. Okay. When do you guys want? Tell me. 17th is Eid. Please keep after 17th or before 15th. Okay. So before 15, guys, back-to-back sessions are there. And because MRCPI Part 2 fast track is going on, every 3 days I have that. So 22, 23 is okay. Next Saturday, Sunday, next to 15. Or 21 is okay. 21 Friday.
Ma'am, put the most of the session in the evening, like 2 GMT.
We do in the evening. Yeah, we do in the evening.
Ma'am, I think the next session of long circuit is on 28. I'm not sure. If it is 28, we will need time for it also.
Okay. So you people can write the suggestions. I'll tell the moderator to do a poll in the group. Okay? Then we can decide. Okay?
Means like 18 or 19, I hope will be fine for the first session. But of course, it's up to you and it's up to all.
So what we can do is that we can keep the next one, or I can tell her that around the next weekend we can keep it. Okay? 22nd or 23rd, we can keep it. So there would not be, then you have like 5 days for the long case as well. I'll write in the group, I'll do the poll and then you people can decide.
22nd, 23rd will be good.
That's weekend, okay?
Yeah.
Saturday, Sunday. Like next, leaving the next and next to next.
Yes.
Okay, no worries, we can do that. Okay, I'll just put the date and the timings for the weekend. All right? Okay, thank you so much. I love you all. Take good care of yourself. I am so grateful for all this preparation which you guys are doing and having faith. And I'm very, very grateful for all the collaborations that the Ireland had been doing with RFA, with all this MRCPI students all over the world. And you people would see the difference gradually in your preparation. I have full faith in you guys that you guys would do it. Thank you so much, all of you. Take very good care with this aim, with this oath that we all would work hard, hands in hands together, making it a success. We just need blessings in our path. May all the best of the health be with you guys, best of luck be with you guys. Everything's going to be perfect. Have faith. And if you don't understand anything, do not hesitate to contact, but just make it a success for you, for your families, and for me, please. Thank you so much. Bye-bye. Take good care, everyone. Please take care. Remember in prayers. Bye-bye. See you guys in the study group. Thank you. Bye-bye. Take care.